Sana ko nagtag ko sa akin. Ya, ujah mana nagtag.
Buyun, suaramu metu Buyun.
Sana ko nagtag ko sa akin.
Buyun, suaramu metu Buyun.
listeners. This conference also provides a great opportunity for prospective participants to share their recent theoretical knowledge, research findings, and experiences in dealing with health and education system. As such, this conference will feature presentations by international speakers which are cutting-edge session topics. Distinguished guests, ladies and gentlemen, we would like to read the structure of this opening ceremony. The first is opening, the second is Indonesian National Anthem, the third is welcome dance, the fourth is speeches. The first speech will be delivered by the chairperson of the third Joint International Conference 2021. The following speech will be a welcome speech by President of GIZ. The third speech will be opening remark by Rector of Unipdu, and the last speech by Chairman of Yapetidu Foundations. And number fifth is the prayer sessions, and will be ended with a photo session by Zoom. Distinguished guests, ladies and gentlemen, for the very first time, let's commence the third Joint International Conference 2021 opening ceremony program by reciting Basmalah together. Bismillahirrahmanirrahim. Distinguished guest participants, ladies and gentlemen, please raise for Indonesian National Anthem. Thank you. Distinguished guest participants, ladies and gentlemen, let's continue to the next agenda, which is speeches. For the first speech will be delivered by the chairperson of 3rd Joint International Conference 2021. We would kindly invite Mr. Andi Yudianto Eskopnes, MKes, to deliver the speech.
Good morning, everybody. The Honorable Rector of University of Pesantren Tinggi Darul Ulum Jombang, the Chairman's Foundations Pesantren Tinggi Darul Ulum Jombang, Head of IIK Strada Indonesia Kediri, Head of STIKES Rumah Sakit Baptist Kediri, Head of STIKES Karya Husada Kediri, Head of STIKES Bakti Mulia Kediri, Head of STIKES Hutama Abdi Husada Tulungagung, Head of AKPER Dharma Husada Kediri, and Head of AKBID Dharma Husada Kediri, distinguished speaker, all participants, and the organizing committee. on behalf of the organizing committee of Joint International Conference, I would like to express my thanks for participating in the third Joint International Conference on Reframing Health Education, which has a theme after COVID-19 pandemic, health and education system resilience. COVID-19 is an unpredictable global crisis, and the epidemic has required speed of all sectors. So the speed of response in the health system and health education is increasing the role of preparing health education, research, community service in dealing with the COVID-19 pandemic as needed by current condition. So most fundamentally, this strong and enduring flexibility and agility are important components of resilience. This resilience can be built with the value of the axis of all us as a people working on the health sector. So if we want to be better prepared for the future, we may need to reconsider the idea of value and always maneuver to innovate. After review activities, about 150 abstracts were accepted for presentation, and 201 people, including academicians, practitioners, research, and students from across all 3 continents and different provinces in Indonesia participate in 2 days virtual conference. I would like to say thank you, our great speaker and expert from member GIC's International Cooperation and Partnership. Member of GIC are fortunate to have partnered with Mahidol University of Thailand, Taipei Medical University of Thailand, Queensland University of Technology of Brisbane, Australia,
Recording in progress.
the University of America. Then we are also proud to announce that third Joint International Conference is being conducted along with the collaboration among 8 institutions of health education in Indonesia. The Health Science Faculty of Pesantren Tinggi Darul Ulum Jombang, IIK Strada Indonesia Kediri, STIKES Rumah Sakit Baptist Kediri, STIKES Karya Husada Kediri, STIKES Bakti Mulia Kediri, STIKES Hutama Abdi Husada Tulungagung, AKPER Dharma Husada Kediri, dan AKBID Dharma Husada Kediri. Thank you for collaboration and support in the running of this conference. Finally, I hope that this conference having good contribution in increasing the quality of research. Thanks to all of committee member of GIC's 2021 who have worked very hard to run the conference. We thank our participants to present this research paper, to share intensively and exchange the idea, thought, and discussion, so that this conference facilitates the information of networks among participants. Please enjoy the international conference. Thank you and happy conference. Assalamualaikum warahmatullahi wabarakatuh.
Recording stopped.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, distinguished guests, participants, ladies and gentlemen. Now we are going to listen delivered by the President of Joint International Conference, who is also the Dean of Faculty of Health Sciences Unipdu Jombang. We would kindly invite Mrs. Pujani S. MKes to deliver the speech.
Assalamualaikum warahmatullahi wabarakatuh.
Salam.
Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. La haula wala quwata illa billah. Honorable Vice Governor of East Java Province, Dr. Haji Emil Elistianto, Dardak Bachelor of MSc. Respected Chairman of Yapetidu Foundation, Dr. Andes Kiai Haji Muhammad Zainuddin Wijaya As'ad MS, respected Rector of UNIDU, University, Professor Dr. Kiai Haji Ahmad Zaro, MA. Vice Rector, Deans, representative from 7 Hut School GIC members, presenter committees, distinguished guests, ladies and gentlemen. It is a great pleasure for me to welcome you all the Joint International Conference 2021 with the theme after COVID-19 pandemic had an resilient. Ladies and gentlemen, now we still live in COVID-19 pandemic. This pandemic has shocked all countries globally and weakened all systems in every country, especially the health and education system. According to UNICEF, at least 98.5% of the world student population experience new school policies such as school closure, distant learning, and no school interaction. Global discussion, ideas, and innovation are critically needed to improve the current responding strategies of COVID-19 in the health and education system. Therefore, the committee initiated the international conference by inviting experts and leaders around the world. Distinguished guests, ladies and gentlemen, the Joint International Conference 2021 is held in collaboration between 7 Hut School in East Java. And this great opportunity, I would like to introduce all the head of Hut School who are also GIC members. Number 1, Rector of IIK Strada Indonesia Kediri, Dr. Sentot Imam Suprapto, MM. Number 2, Head of STIKES RS Baptist Kediri, Mrs. Selvi David Richard, Askapnas MKAP.
Thank you to all who were involved in this event. I am the head of STIKES Rumah Sakit Baptist Kediri. In particular, I would like to thank all the speakers who will share knowledge with all participants of the international conference.
Thank you. Number 3, Head of STIKES Karya Husada Kediri, Mrs. Ita Eko Suparni, SSID MKAP.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody. I'm very like to join international conference. Halo, Assalamualaikum warahmatullahi wabarakatuh.
Di unmute. Number 4, Head of STIKES Bakti Mulia Kediri, Mr. Ahmad Wasis Setiadi, Askapnas MSI MPH. Number 5, Head of STIKES Hutama Adi Usada Tulungagung, Dr. Haji Yetno SKB MPD.
Okay. Good morning, the distinguished guests, ladies and gentlemen. I'm Farida, as a Vice Chairman of Hutama Abdi Usada Tulungagung Nursing Academy Indonesia. Hopefully this event can run fairly until the end. Success for all, yeah? Thank you.
Thank you. Number 6, Head of AKPER Dharma Husada Kediri, Mr. Herni Kristanto, SKB MKes. Number 7, Head of AKBID Dharma Husada Kediri, Mrs. Siti Komaria, SSID MKes.
Assalamualaikum warahmatullahi wabarakatuh. Thank you for joining us in. Sukses for all. Assalamualaikum warahmatullahi wabarakatuh.
Distinguished guests, ladies and gentlemen, let me finally wish you a successful Should Train International Conference and may Allah always bless us. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Assalamualaikum warahmatullahi wabarakatuh. Thank you, distinguished guest participants, ladies and gentlemen. The next speech is the opening remark by Rector of Unipdu University, who will also officially open the conference. We would kindly invite Professor Dr. Kiai Haji Ahmad Zahra MA to deliver the speech as to officially open the third Joint International Conference 2021.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala asyrafil anbiya wal mursalin. Sayyidina Muhammadin wa ala alihi wa ashabihi ajma'in. Subhanaka la ilma lana illa ma 'allamtana innaka antal alimul hakim. Allahumma anfa'na bima 'allamtana wa 'allimna ma yanfa'una wa zidna 'ilman nafi'a. Amma ba'd. The Honorable Vice Governor of East Java, Bapak Dr. Haji Emil Alistianto Darda, MSG, as the keynote speaker of this conference. The Honorable Chairman of Yapetidu Foundation, Al-Mukarram Kiai Haji Muhammad Zaimuddin Wijaya Asad, MS. Vice Rectors of Unipdu, Bapak Dr. Haji Muhammad Zulfikar Asad MMR, Bapak Dr. Haji Ahmad Zakaria MKes, Bapak Haji Muhammad Zahrul Azhar SIP Kepnes, all deans of Unipdu, especially the Dean of Faculty of Health Sciences Unipdu, as the President of GIC, Ibu Pujiani MKes. My dear colleagues, the participants, representative from 8 GAC members, committees, and all participants, distinguished guests, ladies and gentlemen. First of all, let me express my feeling that I am very proud to witness all parties, hand in hand, make an effort to organize and run this academic program successfully, even though we are now still struggling to fight the COVID-19 pandemic. In our event, the third Joint International Conference 2021, with the main theme after COVID-19 pandemic, health and education system resilience. I believe that during this conference, all of us here are going to engage in fruitful discussions and obtain useful information. The term looks simple and short, but it demands full effort, energy, and thought to deal with challenges and strategy related to health and education in COVID-19 pandemic era. Nobody can deny that COVID-19 pandemic has significantly affected all levels. Therefore, as academicians, we need to talk. We need to have discussions where we can share the most recent findings related to how the disease has impacted our education. Another important part of holding this event is to provide an opportunity for networking among policy holders, experts, professionals, and students in order to appropriately respond to developments in education and health fields. In this opportunity, I would like also to express my sincere gratitude to the directors of IIK Strada Indonesia Kediri, STIKES Rumah Sakit Baptist Kediri, STIKES Karya Husada Kediri, STIKES Bakti Mulia Kediri, STIKES Hutama Abdi Husada Tulungagung, AKPER Dharma Husada Kediri, and AKBID Dharma Husada Kediri. Also, to all FIK Unipdu loyalists, I am proud of you and grateful for this event. Distinguished guests, ladies and gentlemen, I'd like to commence the program by reciting Basmalah together. Bismillahirrahmanirrahim. And I'd like to declare that the third Joint International Conference 2021 is now officially open. Hopefully, this cooperation and friendship would continuously contribute to the health and education of the people in this nation and people in many global contexts. The third GIC will be amazing, I'm sure, and have beneficial effect on health and education for all. That's all. Thanks very much. Wallahu muwaffiq bil aqwamit. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you. Distinguished guests, participants, ladies and gentlemen. The next agenda is the speech by the chairman of Yapatido Foundations. We would kindly invite Mr. Dr. Andes Muhammad Zaimuddin Wijaya Asad, MS, to deliver the speech.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma salli ala sayyidina Muhammad wa ala ali sayyidina Muhammad, amma ba'd. The Honorable Vice Governor of East Java Province, Bapak Emil Darda, the Honorable all of the speakers, especially Dr. Richardson and Dr. Michael White, and all of participants of the such join international conference from many different countries, wherever you are from. Today, I'm very grateful to God for his blessing in the form of extraordinary happiness that I feel because at the moment I can be here attending this event together with health scholars from various countries. Actually, my happiness is quite natural, considering that at the time we are still battling COVID-19, thus this forum as if we see light at the end of a dark channel. I believe that I will find a number of alternative of solution to some medical and non-medical issues, both during and after pandemics. Ladies and gentlemen, it should be noted that the COVID-19 for me, as a person who is not very familiar with health-related science, sees that COVID-19 not only deal with health problem, but it also trigger other serious problem. For example, problem that are faced by and in the educational context, which are even more complicated. This is the issue that this conference aims to tackle. Therefore, I really hope that academicians in this forum are going to contribute quality and applicable ideas to provide understanding to the wider community about a healthy lifestyle while we are coexisting, quote unquote, with COVID-19, as well as to better prepare ourselves in anticipating the emergence of the third wave with new COVID variants. That's what we are from me, ladies and gentlemen. I'd like to say, have fruitful discussion in this conference. I hope you will be enjoy the conference. May God always bless us all. Thank you very much. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, distinguished guests, participants, ladies and gentlemen. Now we are almost in the end of our opening ceremony program. To close the opening ceremony, we would like to invite Vice Rector of Finance, Human Resources and General Affairs of Unipdu Jombang to lead the prayer. We would like to invite Dr. Haji Muhammad Zulfikar Asad MMR to lead the prayer.
And blessings. And the IC can improve our knowledge, especially in the health science sector. We hopefully COVID-19 pandemic will soon disappear from all of us. Let's we pray according to our religions and faiths. And in this event, I will lead in Islamic way. Bismillahirrahmanirrahim. Allahumma salli wa sallim ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad. Allahumma fir lil muslimina wal muslimat wal mu'minin wal mu'minat al ahya minhum wal amwat. Allahumma arinal haqqa haqqa warzuqna tiba'ah wa arinal batila batila warzuqna ijtinabah. Rabbana hab lana min azwajina wa dzurriyyatina qurrata a'yun waj'alna lil muttaqina imama. Rabbighfir lana wa liwalidayna warhamhuma kama rabbayana shaghira. Allahumma ja'alna wa auladana wa talamidana sholihan jamilan muti'an mubarakan aliman sihatan. Allahumma ja'alna wa auladana wa talamidana min ahlil ilmi wa ahlil amali wa ahlil khair. Allahumma tawil umurana ya Allah. Allahumma yassir umurana ya Allah. Yassir umurad dunya wal akhirah. Wa ja'alna bihusnil khatimah. Wa sallallahu ala sayyidina Muhammad. Walhamdulillahi rabbil alamin. Al-Fatihah. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you. Distinguished guests, participants, ladies and gentlemen.
Itu ada prodi kayak sains atau IT,
Wah.
Is with us today, and we have also with us Dr. Supapa Petraswan. Good morning, Prof. Doctor. And then okay. The third, we have Prof. Chiu Feng Lin, PhD. Good morning, Prof. And then we have Dr. Nurse Muhammad Maftul Huda, MCUP. Good morning, Doctor. And we have Mrs. Diah Ika Krisnawati, Nurse MSc, PhD. Good morning, Ibu. And then number 6, we have Dr. Kailin Dingle, PhD, MPH. Good morning, Doctor. And stay with us also today that we have Dr. Jericho F. Pardosi, PhD. Good morning, Doctor. And we have from America, we have Dr. Barbara Richardson, DNP, RN, INEP, FNPC. Good night, good evening, Dr. Barbara. Okay, then we have also from Lee University, Dr. Michelle White, DNP, RN, IPN, VNB, BC. Good evening, Dr. Michelle. We have also the Putu Indra Swari Arianti Eskemnas MCUP, and we have Dr. Biba Melda, and we have also Dr. Masrora. Thank you for joining the opening ceremony program today that we hope the next time. Oh yeah, we have with Dr. Barbara. or Dr. Michelle bisa? Okay, good evening, Dr. Barbara. Can you hear my voice?
Yes, I can. Good evening. It's my pleasure to be here and join you from Lee University in Tennessee, USA. And I look forward to speaking to you tomorrow.
All right, because Dr. Barbara has session with tomorrow, so thank you for joining us in this ceremony. And then we have Dr. Supapa Petraswa. Are you still with us, Dr. Supapa?
Yes, I'm here.
Okay, can you say something to greet participants?
Yeah, good morning, ladies and gentlemen. It's nice to be here today to join the conference. It's such an honor to be invited. Looking forward to seeing you soon. Oh, sorry, my camera was wrong. Okay.
Okay, and we have also Prof. Chiu Feng Lin, PhD. Good morning, Prof. Are you with us today, this morning, especially?
Yeah, good morning.
Okay, say something to greet the participant of the third Joint International Conference today, Prof.
Yeah, sure. It's nice to be here and hope I can enjoy the conference and you can enjoy my lecture later. Yeah, thank you.
Okay, thank you. So your session will be today, ya, Prof. Ya? And we have also Dr. Michelle White from America. Can you say something to greet us, Dr. Michelle?
Hello, everyone.
Okay.
Pleasure to be here, and I am looking forward to speaking with you tomorrow.
Okay, thank you so much for joining this opening ceremony program, and that we'll meet you tomorrow morning in Indonesian time, and also and American time is night, yeah? Okay, thank you everyone. So that we have finished our opening ceremony program today. Thank you so much. And then forget after this that we have the keynote speech with Vice Governor of East Java Province with Dr. Emil Elestianto Dardak. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Distinguished guests, ladies and gentlemen, I hope that participants are still here. So we focus on participants. This session will be the keynote speech by Vice Governor of East Java Province. So we want to say sorry that Dr. Emil couldn't join virtually directly with us since due to his tight schedule. Dr. Emil sent his best regards to all of us and to all participants, speakers, committees of the third Joint International Conference 2021. And he says sorry to not be able in touch directly with us by Zoom and the schedule, but finally, fortunately, he has sent his keynote speech through video. Before we display the video, I want to read short bios from Dr. Emil. Dr. Emil, his name is Emil Elestianto Dardak, was born in Jakarta, 20 May 1984 as the eldest children of 4 siblings. Dr. Emil has finished his undergraduate degree at the University of New South Wales, and he eventually completed his formal education after graduating with a master's degree and doctorate degree from Leeds-Sumaikan Pacific University. And for the political career, Dr. Emil is elected a regent of Trenggalek in 2016 to 2019, and he is from 2019 at present time or current time, he is a Vice Governor of East Java Province. Distinguished participants, ladies and gentlemen, so let's enjoy the video of keynote speech by Dr. Emil. Let's enjoy together.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semuanya. Yang saya hormati panitia dari the Third Joint International Conference yang mengangkat tema After COVID-19 Pandemic, Health and Education System Resilience. Pertama-tama saya ingin mengucapkan selamat congratulations kepada panitia, organizing committee atas terselenggaranya konferensi internasional ini di Universitas Pesantren Tinggi Darul Ulum Jombang. Tentunya ini adalah sesuatu yang membanggakan bahwa Universitas Pesantren Tinggi Darul Ulum Jombang dapat menyelenggarakan International Conference, menjadi tuan rumah yang kemudian memfasilitasi exchange of knowledge. Yang penting sekali, apalagi kalau kita bicara mengenai COVID-19, tentunya resilience dalam bidang pendidikan, education, kesehatan, health, ini menjadi sesuatu yang sangat-sangat relevan dengan apa yang kita hadapi. Izinkan saya sedikit menyapa apabila ada peserta yang tidak berbahasa Indonesia. The experience in COVID-19 has taught us that education and health system has to be improved in order to anticipate any kind of infectious disease such as COVID-19. We never guarantee that such things won't happen again. We can only prepare ourselves adequately. And that is why digitization is very important. During COVID-19, one of the biggest concerns we face is the fact that aside from COVID-19 treatment, a lot of people, a lot of citizens still need to continue treating their medical conditions. Some people have pre-existing medical conditions that require a frequent and routine visit to the doctors to check themselves. And therefore, we learned the importance of telemedicine. Telemedicine is very important. The ability of hospitals to ensure that the health personnel, the medical personnel are adequately protected from infectious disease, and they can tend to other patients who are not actually having COVID-19. A lot of people are scared to go to the hospital during COVID-19, and therefore the ability to manage the system so that at times of COVID-19 or any other future infectious disease, the system doesn't collapse in handling the other medical conditions. And in terms of education, one of the key importance is also digitization. And we know it is very multidimensional when it comes to education. It's not just about the provision of technology, it's about also the fact that learning is very different when doing it in class and actually doing it online. And therefore, it is very important that not only the teachers, but also the community has a system. So the community has a system to help students at home to be able to study effectively. Some families have lack of access to internet. The government tried to address that by providing quota subsidy so that they can access the internet. Some have limited access to gadgets, and actually developing community learning centers can help with that. Some very young students still require supervision while the parents may be actually working. So there needs to be those community learning centers allowing them to actually study with assistance on a neighborhood scale. Now, these are some of the lessons learned during COVID-19. And I believe that when it comes to health and education, or health education as such, we also see the need on how we can mobilize health discipline students, okay? Students studying on health related disciplines, including medical or paramedical area of study. So at times when they need to be mobilized to help strengthen the medical handling, either at medical facilities or to help with public health initiatives, such as during the testing and tracing process of COVID-19, then we need to know how we can involve them. In the vaccination process, how we can involve paramedics to help with the health screening for citizens who are going to get vaccination, for example. How we can actually help disseminate information about health measures that need to be taken. So all these becomes very important, and I hope that these aspects are discussed in the third joint international conference. It's being held at the Health Faculty of the Universitas Pesantren Tinggi Darul Ulum Jombang. Akhir kata, kembali saya ingin mengucapkan selamat atas diselenggarakannya Third Joint International Conference ini. Tentunya penting sekali bagi perguruan tinggi di Jawa Timur untuk terus terkoneksi dengan jejaring internasional. Mudah-mudahan konferensi ini akan menghasilkan solusi-solusi yang konkret dan solusi yang dapat kita terapkan karena kita belum keluar dari masa pandemi. Kita masih dalam masa transisi, kita berharap kita bisa keluar dari pandemi dan diperlukan peran dari seluruh elemen, termasuk universitas sebagai bagian dari pentahelix untuk bisa mencari solusi yang inovatif dan ikut menerapkan solusi tersebut. Terima kasih. Congratulations for the third Joint International Conference at Universitas Pesantren Tinggi Darul Ulum Jombang. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Dear participants, ladies and gentlemen, now we are about to have the first and the second main session of the third Joint International Conference 2021. We are going to have with the speakers. The first is Assistant Professor Dr. Supapak Petraswan from Mahidol University of Thailand, and also that we are going to have Professor Q Feng Lin, PhD from Taipei Medical University, Taiwan. To handle this session, we have Mr. Sahari from IIK Strada Kediri. Let's meet Mr. Sahari first. Good morning, sir. Good morning, Mr. Sahari. Can you hear my voice, Mr. Sahari? Yeah, we are still waiting for Mr. Sahari to respond in our main Zoom. Okay. Good morning, Mr. Sahari. Okay. Okay, good morning, Mr. Sahari.
Hello.
Okay, so you can hear my voice?
Yes.
Okay, alhamdulillah. So for the next 10 minutes, so we'll give the time, give all control to you, Mr. Sahari, to be the moderator of these sessions. Distinguished participants, ladies and gentlemen, so I give the time to the moderator of these sessions. Mr. Sahari, the floor is yours now.
Dibantu share skill. Hello, good morning, ladies and gentlemen. Hello, can you hear my voice?
Yes, Mr. Sahari.
Okay. Okay, checks. Ladies and gentlemen, can you hear my voice? Okay, check. Ladies and gentlemen, can you hear my voice?
Yes, Mr. Sehari.
Hello. Okay. If you then have a problem with my voice, please just give a note. Okay, ladies and gentlemen, before we go to the presentations, let me introduce you for the speakers today. That we have two speakers for this international conference. But before of all, I'm going to introduce you for the first speakers. Okay, we have the first speaker that going to present the first presentation. First is Assistant Professor Supapa Petrasuwan, PhD RN from Thailand, Bangkok. Lecturer of Mahidol University and affiliation of Faculty of Nursing, Mahidol University, Bangkok, Thailand. And his position as the chair of Faculty of Nursing, Mahidol University. In 2003, graduated from PhD Nursing, School of Nursing, University of California of Capitol Hills. And then in 1999, graduation from MSc of Treatment Health Nursing, Medical College of Virginia, Commonwealth University, United States.
Masuk di sini. Saya tanya tadi ke.
Keluar. Okay, for the speaker, we have about 30 minutes to present the presentations, and then in the last going to give you for the audiences to ask questions. We have about 10 minutes. Please, for the audiences, if you have a question, just keep your question first. Wait till the end of the presentation. So, ladies and gentlemen, now let's welcome together for our speaker. For the first speaker, let's welcome together. Check. For associate member, please. Hello, sir.
Yes, I'm here. I'm trying to share the screen.
Yeah. If you have a problem, please let me.
I think it's okay now. You see my screen right now, okay?
Yeah, we can see.
Okay, thank you. Okay, good morning, ladies and gentlemen. It's such a pleasure to be here today, and I would like to thank for the organizing committee of the JIC 2021 for inviting me to share my experience about Thailand challenges and strategies that we have done in the health school system. I'm from the Faculty of Nursing, so mostly will be in the health science system. And to be brief, like just to begin, I would like to share about like, can you hear me? Can you hear me?
Yes,
can
sir.
you? Okay. My screen was, okay. I'm not sure if you see my screen or not, because it's just.
We see, yeah, we can see this.
Okay, it's a big screen already, right? Okay.
Thank you. Sorry. Okay. I'm not just gonna talk much, but I just wanna remind all of you that the COVID-19 is a public health pandemic and a global crisis that all over the country in the world, facing these problems and every aspect of our lives, and then devastating many part of society, the economic and the political implication, especially in our health. In the healthcare systems. And this just the situation of the spread of COVID-19. Everyone still remember that it started since the end of 2019. So that's why we call COVID-19. And then until 2020, around March 11, WHO declared the spread of COVID-19 as the pandemic. So ever since, because Wuhan is a big city, a large city, we have international connections, about 19 million people. And so it quickly jumps from China to all over the world. And when it comes to Thailand, we found the first case in the beginning of 2020, in January 2020, which a first case we found in the female tourist who came from China. And then about the end of that month, the first Thai case we found in a taxi driver who never been out of the country. He just have many passengers who come from the tourists from China. And ever since from January to May in 2020, the case of COVID-19 increased slowly but steadily, both from imported case and local transmission. And then May till November 2020, as the case of COVID-19 were among persons who had caught infection abroad and came into the country and were repatriated to the Thailand and put in the state quarantine. That's we found the number. And then around 2020, WHO, the Minister of Public Health of Thailand announced that the COVID-19 was a contagious communicable disease. And then talk about the wave of the pandemic, the outbreak that affect all of us in Thailand, and I believe that all over the world. The first wave became around March 2020, and then we found out that the case was found in the boxing stadium and nightclubs in Bangkok. During that time, Thai people was infected more than foreigners and more than migrant workers. And around the end of the year of last year, around December to the beginning of this year, we found a very big cluster. The first one around November, we found a Thai worker who worked in an entertainment club in Myanmar, entered to Thailand illegally. And so when she came to Thailand illegally, so she was not captured by the state quarantine. And then she went all over the country. She came to Chiang Mai and then came to Bangkok, go to meet her friends and everywhere. So that's why we got a lot of infect. And then unfortunately, December of 2020, the wholesale shrimp market in Samut Sakhon province, we found a big case because all over the country, they came for the seafood over there and then go all over the country in other provinces. And we found during our second break, we found a lot of migrant workers who got infected, more than the number of Thai people and more than a number of foreigners. But up until now, I would say we're still in the third wave of Thailand because it's still number is decreasing, but still a lot. But now the government have another regulations that announcements that people can go out more, maybe school will start soon in this year. And if all of you know, Thailand just opened the country in this month on November the 1st. But since we are in the third wave, which started around April 2021, this wave, Thai people got infected more than migrant workers and more than foreigners. This is the information from Ministry of Public Health. And the three waves of COVID pandemic in Thailand is due to source of population at risk factor, like close contact with previous confirmed case, which a lot of our family members and then even colleagues. And the community risk, the cluster communities and active and community surveillance. And this is a number that updated because every day in our country will announce the case around 11 PM by the government. So this is the current very update from yesterday. We got the confirmed case in the total about like 2 million people, and new cases that is decreasing. When it's about a lot of outbreak, we got like 10,000, 20,000, but now we're decreasing to about like 6,000 cases. And now since we have to monitor, because we open the country, we accept a lot of tourists, but we have like a special policy. And this is the number that they came. And this I want just to show you to pair like where Thailand is. For the international situation, the confirmed case up until yesterday 10 a.m. The confirmed case is about like 254 million people, and daily increase is about 400,000 cases, and number of deaths is around like 5 million people, which come to the case fatality rate is 2.01%. And for our country situation, the confirmed case is about 2 million, and the daily about yesterday like about 6,000, and the number of deaths we have, the deaths people died from the coronavirus is about like 20,000 people, which make us have the case fatality rate about like 0.99%. It's still far, but still like we take it seriously. And so of course the impact, when it comes to the impact of COVID-19 pandemics, it has impact to our sector, including health school system in Thailand, of course. And as the crisis escalated, since that I show you from the first wave, second wave, and third wave, the Thai government closed schools and universities to ensure the safety of students, of the teachers, the lecturers, and the nation. That the Ministry of the government that involved pretty much is our Ministry of Education, and the university is under the Ministry of Higher Education, Science, Research, and Innovation, and also we have like some health science school, like nursing school under the Ministry of Public Health. So we all have to close school. And coming to the Mahidol University, whenever the Ministry of Higher Education, Science and Innovation and Technology have announcement, our president will have to got like to do the announcement to have all the personnel and our students to know. This is just an example that we have like the announcement in the website of our Mahidol University, and we have the announcement from President of Mahidol, and we have like the safety precaution, and this is like the announcement how we have to work from home, like nobody's around on campus, you have to have permission or something like that. So it depends, you can see like the numbers, the announcement that we came out from our university, from the president office, like there are tons of it, because like because the update for the situation, the events like really quickly, and then like for until now, you know, like until last year, and we have like the guidelines how to like organizing the activity. Actually, we are not on campus until this month when the government starting to open the country and trying to like to cut loose for like, and then like so but we also have some policy, and of course from this that I told you that affect for our health school system pretty much, and this is the impact because of the outbreak. Of course, that's the face-to-face classes, the clinical skill laboratories, especially for our health science, right? Very important for the clinical aspect of students. So all have to suspend in order to maintain and safeguard of the health of the student, of the faculties. Here, like normally, like we have the face-to-face in class, like even practice in the lab or even practice in the hospital. So everything has to suspend without knowing when it came back. You know, like but the first wave came, we just thought like, okay, we'll get better soon or something, but just hopefully. But now since we've been with the virus for like almost 2 years, so we have to adapt ourselves in our school. we have to comply with the COVID-19 prevention protocols of like all our university, and then even we have a related affiliated house sectors like a university hospital, something like that. They will have like the protocols, and so when we suddenly like change from traditional face-to-face to teach to the online teaching to like deliver like a virtual mode of our teaching and learning. This is just an example of our students when they're at home, and both like a bachelor's degree and postgraduate level. And these are the platform that, you know, like the first came out, and then suddenly because the outbreak already there, everyone have to adjust ourselves. And then like, so we have suddenly to learn by ourselves, and also got training from our university to use the platform. These are the platform that mostly used, as I guess like, which is similar to every country. And the instructor, as I said, the instructor was forced to learn, like actually like were trained and actually were forced to learn how to navigate and deliver the course content online, do the virtual classroom, and students, families were forced to provide the need technology and internet services required to access to the class online. As you probably know, it will be have the same like for the countries, like, you know, my country have having the same problems, especially for the children in elementary school level, primary school, because, you know, like from the survey of the government, about half of our children all over the country, about half of them do not have the device. And then about a quarter do not have the internet access, which is a very big problem. And the government tried to do everything, you know, like providing like a satellite TV. Maybe you can share together. Some children like use their parents' smartphone just to learn and then come together. We'll see a lot of that pictures came out in the news. And then when come to the college student, university students, you know, like for the health side, I'll give you some example, like my faculty of nursing. You know, like most of the students maybe not like come from a very rich family, will come from maybe like middle income or low middle income, and then live like in remote area. I remember like when I taught them, you know, like sometimes they don't, the internet connection was not good, and then like the student will ask us, because suddenly when the government announced and the president of the Mahidol University and like we have to use online, every student go back to their hometown, which is all over the country. And then in their hometown might not have a very good internet connection, but they were forced, and we as teachers were forced to learn to use the online virtual mode. So like sometimes they have to go like, you know, have to go into the city just to like print out something, you know, like, so that's a very problem that we have faced all along these 2 years. And then some like, you know, still use the smartphone. Not all our students have like a laptop. So that's another problems. And another problem that we have is just like the inequality in access to online learning, as I said, you know, like they do not own the required textbooks, dependent on the libraries, you know, like in Mahidol we have a very good database, so they can access online and even go to the real library, but since they have to go back home and then study online, that's another problems. Because of the internet, they cannot access to online, and then they don't have the computers and the type and capacity of the device, because some of them, because you know that this Gen Z for now, like they use a lot of smartphone, but maybe not a very fancy one, and then just a limited capacity of the device. So that's why they have insufficient memory space, and then the battery life of the device will always have problems. Because when I taught online and then suddenly someone disappears something, and then it's like, you know, it's all about like the mobile, the device they use, and also the internet connections. And here, not a lot of students that have the iPad. So some might have, but some may not. And another thing is living in the distant geographical area in the country, which is not good. They don't have enough money, you know, inadequate financial resource, and it's interruption to the way of student social life takes place. and they have to learn and adapt to different platforms that other teachers use, like Google Classroom, Microsoft Teams, WebEx, Zoom, and Moodle. And then like the length of study, because in some institution, because of they don't have the clinical placement, it longer to finish all the requirements of nursing degree, for example. That's all the problems that we're facing during the COVID pandemic. And since we have to deliver our teaching and learning online, and then you have to suspend the clinical practice. So like any program could be extended for at least additional semester to facilitate the needed clinical experience and clinical hours required by the governing bodies. And also, but however, it depends on the institution policy too. I will give you some example, like our nursing student this year, we finish around like May, and we will help them to study for their license examinations before entering into work as a registered nurse at the hospital. And so they will start around like July. So this year we have to adapt a lot, like for our organize of the class, that so that we have our students to finish their degree on time. Because another problem is that all our nursing students goes to work at Sirat hospitals at the Faculty of Medicine, Mahidol University. Many of you might know Sirat Hospital is a big hospital in the regions, and they require a lot of like new nurses from us, we affiliate with them. So we'll produce a lot of nurses to Sirat Hospital. If we don't finish our have our nursing student ready to go to work, that's another problem for the hospital also, right? And because of the outbreak, many cohorts wards that have was created because many patients in the countries, and there was some resign from the nurse, to turn over it. So that's our need. So our school try every way just to have them, the student, and it's not easy. I tell you, trying to have the student have accomplish all the skills and requirements by the Nursing Council of Thailand, and the competency that they have to meet. They have to achieve all the program learning outcomes and all those things. So all our teachers have to brainstorm and one change a lot, this disruption caused a lot, because the challenge that we got, learn from online, how to engage the students, how to communicate with them, because our students would just turn off the camera and then turn off the microphone, and then whenever come to class, it's difficult because many times I have the lecture, I had the lecture, and I said I threw some questions and very quiet, nobody answer anything, nobody responds anything, which is very much different from face-to-face in class, right? So I have to say, hello, are you there? I always have to say like this all the time, because it's very difficult to communicate when you are online and in distant learning. And also how to assess them when they don't have go to the practicum, and how to assess why they have online teaching, how to give them the feedback, and then what kind of teaching methods that we have to try to engage our students. And then of course come to the technical issues, because we have to lead on the technologies, and also for the students, they have to adapt a lot, and then also they're facing a lot of technical issues, and then the computer knowledge, and then a lot of distraction, because when students study at home, family members come, and then they might not have a big house, right? You share the room with other family members. Whenever, if they turn on the camera, family members would just go round and round. So we have to find out, maybe you can find just a quiet corner when we have class or something like that. And also another thing is that our student, what I'm very worried about them, and then because unfortunately for them, many people said that they miss a lot of opportunity to be in the college life. The first year, the second year, I taught the second year last week, and I just like talked to them like how were they doing, and then like almost coming back. They all were looking for coming back to campus because some of them never even met the classmate in real person because they got enrolled like it's the outbreak, the pandemic just started. So it's just unfortunate like for all of them, people said because the new generation missed the opportunities for learning the social life, that's very important. It's kind of helping them have the soft skill to be in the future. And also here, although we can deliver like online teaching and learning, but still they have the solution is limited the skill development and clinical practice placement of our health science students. Normal approach in traditional health science curricula. This is just when the regular time I show you picture here, like when taught the student in the lab, and then in the learning resource center, we have a big place, but nobody's could come. And also our teachers trying to find many ways, for example, in fundamental nursing, we have to provide all the equipments the stethoscope and then the needle, hammer and everything, just give the students and then have them do the video. Your teacher have the video online. They can just study by themselves, and then they can practice, and then they can practice with the family members when they are at home, and then just record the video on the smartphone, and then turn back so the teacher can check whether you do the right procedure or not. And also we will using the mannequins and standardized patients that we have to develop. I mean, because of this directive and simulation-based learning, simulation teaching, that's we all in every department of our faculty have to develop our own simulation guidelines, simulation-based learning. For example, my background is from the Department of Mental Health and Psychiatric Nursing. So we have to develop a case scenario, for the simulation-based, we have to find standardized patients, for all this to prepare, because in the setting, the clinical setting do not allow the student to go because of the case. They might be afraid to infect, and they got some case infected. So everything is have to suddenly change, and then we have, and then when we try to use a new way of teaching, because at first we just what our school do is just we move all the theoretical courses to teach online during the breakout, and then we'll see how the situation goes. And then finally, it seemed for the third wave, it seemed it's going increasing 10,000 cases, 20,000 cases per day. So so we all have to get together and then work on the simulation-based learning just to be prepared, and then to make sure to see how what's competency that the student needs to have before they graduate, before they finish this course, and then how we can arrange all the simulations just for them to achieve the competency or required skills. And of course, when you do that, we have to develop a method of assessment that is proper for the students' practice in the lab or for using simulation-based. And also now since the situation is getting better from 10,000, 20,000 cases to be now 5,000 to 7,000 a day, this month. So this month we just started to have our students to go back to the clinical area in the hospital, because for example, the Siraj Hospital, they'll just have some protocols that student, they have to have the vaccine, they have to be together in the dormitory. They don't if the school can provide a bus for them to, all those things that's some that we have to just get along, and then with that modified protocols, and some, for example, my student will go to the mental health hospital, and they require that, okay, you might not come every week or every day, it's just very short, much shorter time. And then the rest, we have to have the student learning in the simulation lab instead, but still good because, because we are in health science, the clinical practice is very important, to gain the experience, to see the real patients. And then also our school have to provide all the PPE, maybe now some hospital allow us to wear the gown. And we have to bring shoes before going into the ward, and then we just allowed to be maybe the maximum of 6 students. In the past we have 8, and then 5 or 6 students, and then go and then meet the patients, and then you have interview or something, and then you have to go out from the ward and then to have the conference. So we have to adapt a lot, and then because whatever the protocols that they have, we have to follow the protocols. And also I will give you some example. I am also responsible for the Master of Nursing Science program. And because for the pandemic, for example, we have we gonna hook up with the real professional teams, for our students when you do that. And then so since our healthcare system in Thailand have to adapt, a lot of people for example, in the mental health field, a lot of people got very stressful from the pandemic. In fact, in a family member got infected, they were afraid of going out or whatever those things, like social distancing. And our Ministry of Department of Mental Health of the Ministry of Public Health in Thailand, they have the mental health crisis assessment and treatment team. We call the MCAT team, and they provide phone consultation, telephone consultation, and using some device, like a telemed or something like that. And then so we got that because that allow our students, for our master students, to get to practice in the real situation under our supervisor of the instructor too, to give consultation, counseling, or helping psychoeducation to all the people who suffer during this COVID pandemic in Thailand. That's just an example. And so for the way forward from now, every nursing education institute is required to respond and recover as soon as possible, not only just nursing institution, all the health science, because now it's just time to recover, because now the vaccine, many people in the world got vaccinated, and but the wildlife is good. They just modify themselves. So our nursing school, health science school, need to be prepared for future emergency. Nursing needs to flexible education system that will be able to withstand or recover quickly from crisis and other unforeseeable circumstance. And in going forward, all the health science schools should have contingency plan for abnormal situations such as these pandemics to maybe the new wave again, and every institution should have the backup plans, and then it should be placed because the future is uncertainty, I would say that. And a modernization of the program to include more online and virtual options could help in smooth transition if the needs arise again. And strategy of our school, that's what we plan in this semester about the end. And then for the second semester, for sure, we're going to use the hybrid learning for the blended learning. And then we use synchronous and asynchronous, because the content will be delivered in a combined face-to-face online teaching, and also in the hybrid mode. And using simulation into the program to reduce the effect of similar future occurrence in the clinical practicum of the curriculum. Because, we have to admit that when the government opened the country for the tourists this month, we all a little worried, because we have to adapt ourselves, and then we're not sure if they'll, even we are the lower of the third wave, but because we probably have a new rising of the outbreak again. So, and then we're not sure about the future, but now if things happen again, we are prepared now because we learn. And then in some school could use the virtual simulation or the web-based product, but not all schools can do it because it's kind of the problem about the access and cost of some money. But if you can do that, that's a very good way, during the pandemic. And for the hybrid that we're going to do, like, we have to use like a suitable platform for our students. Like, although we're teaching online, we have to build a class community among all the students and the teachers, and get used to the new technologies. And then they use many platform and many programs, applications. Just try to engage the students and then increase the activities, interactivity in the class, online class. And then of course we should have the proper good assessment and feedback to the students. And another point that I want to give you here, that just like, the coping during and after the crisis should not only be limited to the process of teaching and learning, because students and teachers' emotional well-being should be considered, as this may affect the process and outcome of teaching and learning. Like for myself or all my other friends who are the faculty members from other university, like we have to work from home for like 6 months, 8 months, a year. And then we're just like, sitting in front of the computer whole day and something like that. We just feel like, for maybe 1 month is okay. For the 8 months is not quite okay. So we have to adjust, and then you have to cope ourselves, so our school also concerned about this. So we also set up a counseling and mental health service that are available for both our staff and students, and also the other people during the outbreak too. They can walk in, they can use the Line official, and then use any online platforms. That's another way. So it comes to my conclusion. There are definitely lessons for university to learn from the crisis. And at the same time, there are new opportunities that they can gain from the situation. The COVID-19 crisis served as a wake-up call to reform the entire education landscape, from instructor qualifications, training program, curriculum development, to teaching pedagogy and assessment method. In Thailand, the higher educations, we talk a lot long time ago to use the online teaching, but then, okay, we're going to do one day. And then suddenly we don't have to do anything. The COVID-19 did that for us, for the disruption. Everyone have to adjust to use the online suddenly, So this one maybe might be a challenge thing, a good thing about the pandemics, that we can get done the things that like we planned for a long time ago, And online learning may be a major tool for future the education. Remote and long-distance education will become a new trend. So COVID-19 made university act quickly and implement this right away as a disruption. And university infrastructure needs to be put in place, and instructor must learn the ways to teach and evaluate students without face-to-face contact anymore. And there is uncertainty regarding the end of the COVID-19 pandemic. And as there are high possibility of new strains of the virus emerging, so we all have to be aware, so online learning has become the solution to complete the curriculum for health school system. However, it does not address the clinical practical component among us as a health science, because we still have the challenges in using visual simulation and high fidelity, because it might be limited to some school because they have a lot of costing the money and how to access to them. And then also the clinical practice, it might be like the safety issue that the students, the health science student cannot go to practice in the real hospital because of the safety issue or the supervision issue. So that will still be a challenge for us. So in my conclusion, multi-sectoral intervention should be put in place by the joint effort of government, healthcare institutions, university, and nursing regulatory bodies, or any health science regulatory bodies, to be in preparation at all times to respond to any future emergency that might come up. Okay. Thank you very much for your attention. I'm not sure if we have time for comments or questions and answer or not. Thank you very much for your attention.
So keep your question first until we have finished for the second speaker. So ladies and gentlemen, now we are going to the second speaker. Please wait a moment.
Can I answer? I saw in the chat box. We don't have time.
Boleh. So, Ajahn, do you mind to answer now or after this?
What there was one question. Can I just quickly respond?
Yeah, it's okay. It's okay.
Okay. Yeah. Sorry for this next speaker. Let me respond quickly because they're asking like many countries experience health workers shortage during the COVID-19 pandemics. Do you think involving nursing students to manage pandemic a good idea? If yes, to what extent? Thank you. Okay, let me share our experience. Yes, we involve our nursing students during the pandemic. Like for example, for the vaccinations for the general people, we put our nursing student, like although they don't have the license, they cannot inject the vaccine, but they can screen them and then take the blood pressure and all those things. And also like going in the field because the shortage of like we all of the nurse in the future, and then we have to adapt our nursing student, because the pandemic will be with us for a long time, I would say so. So like it's good when they graduate, they have to go with the pandemic still there. So it's good to put the student, involve the student in any way, any method that we can put them on the clinical practice. Thank you very much.
Okay, Ajahn, welcome. Very good answer, I think, and very informative. Okay, ladies and gentlemen, so we are going to the next speaker, and it will be presented by CEO Feng Lin, PhD. But before starting the presentation, let me introduce a bit about the educational background. Okay, for bachelor degree, here from 1992 to 1996, graduation from School of Medical Laboratory and Biotechnology, Chungsan Medical University, Taichung, Taiwan. And then for the master degree from 1996 to 1998, National Chingkun University, NCQ, Tainan, Taiwan. And for the doctor or PhD degree, graduation from Institute of Basic Medical Science, NCQ, Tainan, Taiwan. Okay, that's all the information about the Tsiung Feng Lin PhD. Ladies and gentlemen, now let's welcome together for the next speaker, for respectable Tsiung Feng Lin PhD. The time is available.
Okay, thank you. Could you hear my voice?
Yes, very clear.
Okay, and can you read the screen?
Yeah.
Yeah, okay, thank you.
Excuse me, can you make it bigger?
Okay, sure.
Okay, nice, thank you.
Okay. First of all, thanks to the committee organizer for inviting me to join the excellent conference and welcome you to join the lecture. Okay, so today my topic is new resident during and after COVID-19 pandemic in Taiwan. Story about the COVID-19 fighting in Taiwan, also the knowledge about the current understanding in COVID-19, particularly in viral immunity, will share in this lecture. So any question raised from this lecture are welcome. So in addition, you may contact me anytime by email. So until now, COVID-19 caused the pandemic infection that over 245 million confirmed cases in the world and almost 5 million deaths reported by the WHO. So all of you should have potential and high pressure in our life under the pandemic. So this slide shows you the confirmed case by country. So you may find your country, okay? Yeah, among the 4 million people getting infection until now. However, in Taiwan, only a close 16,000 people infected. So also you can see a very similar pattern of outbreak time point in our two countries. But the incidence of the infectivity is so different. So you may be interested to know why does it so different. So if there are 100% of COVID-19 confirmed cases worldwide, a few case percentage can be found in Taiwan. So something is different and happened in Taiwan. And how do we make it? So according to the report from the prevention and control of COVID-19 in Taiwan, actually, to organize the game of COVID-19 fighting in Taiwan, Taiwan CDC based Central Epidemic Command Center is firstly organized at the initial stage of outbreak in early 2020. There are so many prevention strategies carried out by moderating the personal protective equipment, integrating the medical supplies, and promoting the healthy education and disinformation management. We did the pandemic surveillance and the laboratory diagnosis. Also, increasing border control and increase the control of community transmission. So to stop the secondary outbreak, vaccine preventable disease control is initial for finding the vaccine from the international collaboration. So at the early stage, Taiwan provided enough personal prevention supplies, such as the face mask, to several countries. So indeed, Taiwan can help health for all. So actually, the most important is our early epidemiological investigation during the early stage of outbreak in China. The report announced the government about the warning sign of the potential outbreak in China. So this message makes the early action in Taiwan CDC. So in the world, the information is key for COVID-19 prevention. So okay, now you may know much how to prevent the COVID-19. First, be healthy, be clean. Again, be clean and disinfect what you may contact the uncontrolled environment. So keep the social distance for avoiding the possible infection. For your regular life, actually, using the pickup and delivery are easy to do for keep the safe environment. So to prevent the COVID-19, we discussed the isolation first. As you know, isolated the infection case is essential to make disease control. During the outbreak, stay at your home is safe. Of course, you may use the personal prevention to avoid the possible infection by using the mask. So all of you agree on the requirement of the face mask during the COVID-19 pandemic. In Taiwan, people may easy to get a face mask by using the map app of face mask. The green color means there are available masks in local pharmacies too. Keep silence is important to avoid the infection in closed space. No further unnecessary contact is also important. So in addition, to keep safety from COVID-19, the impact of mask wearing is shown in this slide. Due to the regulation of the face mask from 2020 and 2021, the amount of the severe pneumonia case in Taiwan are significantly reduced. So now we know much about the preventive strategy against so many kind of the infectious disease, not only the COVID-19, but also the influenza or other respiratory disorders. So we also made the mandatory contact restrictions to control the possible people who may be exposed in case of confirmed case reported. All the strategies are performed to improve the possible risk of the infection. So as you know now, the vaccination is why we need to prevent the COVID-19. This is a personal immunity against the infectious disease. Hopefully, personal immunity may make acquired community immunity, so-called herd immunity. Later, I will explain what is the herd immunity. So in addition to keep safe from pandemic, so boost your immune surveillance is an active strategy against infection. So what is the immune resilience? So in general, it is having an immune system that attacks and eliminates the microbial without hurting your own body or causing excessive inflammation. Yes, it is your immunity. So how to define the immunity? In general, we talk about the innate immunity and the acquired immunity. As you know, it's quite different between these two different kinds of the immunity. That depends the specificity and memory specialized in acquired immunity. In general, we divide it into two parts, active immunity and the passive immunity. If someone got infection naturally, that will cause the active immune response. People may recover from natural infection. However, we can do some artificial activate immunity, for example, vaccination. This will induce the activate immunization to induce the whole host body to generate the immune response against the virus or other bacterial infection. We also have a passive immunity. That means that we can provide the immune response from mother and the artificial from anti-serum therapy. So the question is where you are. You are recovering from natural infection or you are recovering, you received the vaccine, okay, by an activate manner. So using the electronic microscope as observation, the virion that carry the crown structure as coronavirus family. This finding makes us to learn much from the previous SARS-CoV-1 pandemic. The information is important to scientists to make the rapid development of the possible vaccine we have. As shown in this cartoon, an RNA virus carrying envelope protein, as shown here, so-called the spike glycoprotein. As we have known, these spike proteins are required to interact with the host molecules. The idea is making protective immunity by targeting the spike protein. So many vaccines are developed and designed by targeting the glycoprotein spike. So SARS-CoV-2 causes a high transmissible infection in contrast to the previous COVID-1. One possibility is that the variant is on its surface spike compared to the COVID-1. Basically, the variant spike protein show high interactive with its host receptor, so-called ACE2, through an ACE2 mediate viral binding and the endocytosis. The virus fills with the plasma membrane and then uncoat to release its RNA genome for direct translation and the polyprotein processes. This is so-called the viral life cycle. So for immunopathogenesis of COVID-19, once infection in the respiratory tract, the virus is quickly replicated within the alveolar epithelial cells and infect the immune cell, particularly the macrophage. So during viral infection and replication, cellular activation in alveolar, followed by the inflammatory response are triggered. So many cytokines are overproduced and cause the cytokine syndromes in ARDS or acute lung injury. So cytokine syndromes may cause significant risk of the ARDS and death in older people with the pre-existing disease. And so many organ failure can be occurred during the coronavirus infection. So I want to show you some therapeutic strategy against the COVID-19. So serum therapy and the monoclonal antibodies treatment is used to neutralize the virus directly. And adaptive immunotherapy and the cell therapy are used to balance and repair the abnormal immunity, and they can repair the tissue organ damage. Of course, we also developed the antiviral drugs, decoyed biomolecules, and some nanomedicine are used to inhibit the virus infection. However, there are no general the effective therapeutics for COVID-19 or antiviral against COVID virus 2. So I want to show you the immunity against the virus. It's quite important through our personal immunity. In response to the virus infection, several immunity will be generated for beating the infectious viral agent. For example, interferon response, natural killer response, antibody response, and the cellular immunity. I want to use the slide to explain more about the viral immunity. So in our immune system, the interaction of the innate and the adaptive immunity are so close and required for immune response against the virus infection. Generation of Taiwan interferon actually is quite initiated by virus infection. The interferon can release and trigger the antiviral response. Of course, our innate immune cell, natural killer cell, can find the viral infected cell and kill the viral infected cell through some cytotoxic molecules released, for example, porphyrin and granzyme. Also, NK cells are activated to release the cytokine gamma interferon. Such gamma interferon can enhance the adaptive immunity, so-called antigen-presenting cells. So virus can also be infected within the dendritic cells. Once the antigen was processed, actually they can present antigen through the MHC system and will be cause the cytotoxicity and help T cell activation. Followed by the T cell activation, some T cells, for example, helper T cell, can help the B cell to generate the plasma cell the differentiation and maturation to secrete the neutralizing antibody. Of course, such neutralizing antibody provide the protective roles. In addition, we have the cytotoxic lymphocyte response. Such memory-specific cytotoxic T cell also provide the antiviral response. So why do we need the vaccine? This is a vaccine history showing you the development of the important protective vaccine against human infectious disease. For example, in measles virus infection, we developed the vaccine successfully stopped the further infection in early 1970. We believe vaccines or self-immunity is the key for discovery of infection or the prevention of infection. So to control the COVID-19, several vaccines are developed, including the viral vector, genetic, attenuated, inactivated, protein-based, and the repurposed vaccines. In general, targeting the viral structural protein, such as spike protein, is essential for generating the neutralizing antibody response. For vaccine development, so critical issues are antigens, adjuvant, and the route of immunization. All these three parts determine the efficacy of the vaccine efficacy. So yes, we need the COVID-19 vaccine now, but until now, there are over 21 kinds of the vaccine available that have been approved by the FDA currently. Additionally, we will have more choice to take safe and effective vaccine for immunization in the future. The first two FDA approval vaccines are mRNA-based genetic vaccines, and AZ vaccines use the adenovirus-based subunit nucleic acid component. Those both mRNA and the adenovirus-based vaccine provide the early protection during the outbreak of the COVID-19. The other three are inactive vaccine made by China. So different approach are made for generating the potential vaccines as listed in this table. So here I share information that world people received at least one dose of COVID-19 vaccine. You can find so many countries already received their first dose of the vaccine. The information tell you this is an emergent situation that we need the vaccine more because so many countries did not have enough vaccine available. So until July, over 15% of vaccination rate has been reported in your country. At the same time, Taiwan shows a very difficult period for vaccination. We don't have vaccine yet. Due to some international political issue, the amount of vaccinated people is therefore limited as compared to other countries in Asia. Yes, Taiwan's people said we need vaccine now, although we don't have more cases. So fortunately, other countries like Japan and the US give the COVID-19 vaccine to Taiwan at the early of the October. It is an exciting time for Taiwan's people. So until now, we make it possible to immunize the people first who has high risk to exposure into the infected environment, such as older people and the patient with underlying chronic disorders. Now, for the first dose, okay, we received over 70% immunization rate and over 30% for the second dose today. To resolve the limited vaccine available, we made vaccine by ourselves. A company from Taiwan developed a protein-based vaccine. As you can see here, by using the recombinant technique, a classical protein-based vaccine dissimilar with the current mRNA vaccine. This is an innovative vaccine adjuvant fused with this protein vaccine and make more immunogenicity in this vaccine. According to the published data, more antibody response, more antibody titer can be found in and induced by the designed vaccine. So as same with other vaccine, hope all vaccine can be protective in response to the next infection. This is our President Tsai Ing-wen and the Vice President Lai Ching-te. To promote the vaccination in Taiwan, they taken vaccine in an open route. So in Taiwan, we have AZ, Moderna, and the BNT vaccine now. Of course, they have taken the vaccine made by Taiwanese bio company. So for evaluating the benefits and the risk of vaccination, you and I are carefully to ensure the safety of the vaccine. So according to the data of clinical trial, the vaccine provides benefits such as reducing the death, reducing the hospitalization, and decreasing the severe disease progression. So the only things we need to consider is the adverse events and the possible side effects, okay? In general, the physicians should evaluate your health condition before vaccination. So the rate of the adverse case is therefore limited, hopefully. So indeed, the COVID-19 vaccine provides the intermediate protection according to the current data. The black line shows the non-vaccinated case. It's a natural infection study. So you will see some overall survival decrease. However, in vaccinated people, this is adapted from 3 different kinds of the vaccine. they indeed prevent the long-term effect by increasing the survival. However, through the time kinetic change, the protection seems to decrease in both three different vaccinations. What does it mean? The vaccine should be provided long-term protection. So we will have a next generation vaccine in coming day, okay? So vaccine is effective against the infection disease. For herd immunity, most people receive the vaccination to generate the antiviral immunity against the infection. After that, this will also cause the protection in unvaccinated people from further infection. So this artificial immunity, so-called herd immunity. So several issues should be taken and consideration in the future. For example, after post-vaccination, should I need a COVID-19 vaccine? Some people who suffer from diabetes, they are considered, should I take a vaccine because I am a diabetic case? Actually, according to the clinical trial and the data, a poor prognosis in patients with DM because the COVID-19 may cause the severe disease progression in those patients. And the physician suggests the primary prevention is timely vaccinated. So the DM case is the second populations who are immunized the vaccine in Taiwan. Actually, some vaccine different from the COVID-19. For example, pneumococcal pneumonia, influenza, and the hepatitis B vaccine are recommended for immunize those patients to prevent the severe disease during the COVID-19 infection. And the clinical data support a robust neutralizing antibody response after vaccination in diabetic case. So the vaccination in individual with DM is justified, okay? So however, in the future, maybe we should take some consideration on preferred vaccine type, vaccine efficacy, and the frequency of administration, because all of the data are not clear yet. So more studies should be needed to study the vaccination in the chronic disorder peoples. So in autoimmune disorder case, should I need to vaccination firstly? Actually, the patient with autoimmune and inflammatory conditions may be at the risk for the COVID-19 associated disease progression. And similar with the diabetics, actually, they are suffer from the chronic inflammation. So in response to COVID-19 infection, they may develop the severe disease progression. So again, in guidelines, those patients who suffer from autoimmune disorder, they are firstly to recommended for the vaccination. So according to the data, actually, they show some good antibody response in autoimmune disorder case. So they are suggested to receive the COVID-19 vaccine. So currently, the scientists examine whether passing the immunosuppressive medication. As you know, for stop the autoimmune disorder, patient will take the immunosuppressive agent. So you may consider whether the immunosuppressive drug also decrease the immunogenicity of vaccination. Indeed. So this study will be report the final result through the large scale study. Okay. And for the pregnant and the lactating women, actually they are worried whether the vaccination cause some side effect for their baby. But however, according to the clinical trial and some study observation, those cases who are highly severe response to the COVID-19, okay, so in clinical, the pregnant women are suggested to get to receive the vaccine, okay, in our guideline. So because the vaccine protects the severe disorders from COVID-19, so the safety and the effectiveness of COVID-19 vaccination having or during pregnancy has been proven. So no evidence that COVID-19 vaccine caused the fertility problem. So the vaccination is recommended again. So I want to show you some beyond the vaccination. You know, in our body, although we did not meet the virus infection before, however, in response to the immunity, a general and suitable immune response provide the host protection. We don't hope the additional immunity cause the host body undergoing inflammation, undergoing autoimmunity or hypersensitivity. Yes, so vaccination provides suitable prevention strategy against the future infection, because the data obtained from the clinical trial show the vaccinated people are easy to recover from the natural infection. So several things you may need to know for the future response to the COVID-19. First of all, we know there are multiple variants of virus that cause the COVID-19. I mean that there are so many mutant strains can be identified. And this virus caused a very high circulating globally and spread more easily and quickly. And they will increase the risk of the death. And of course, now we have the vaccine, but the efficacy of the vaccine from the different vaccination or different type of vaccines are still need to verify for confirming their neutralizing antibody titer as well as the memory T cell response. Okay, until now, US, UK, and South Africa, and Japan, India, and Brazil have identified the different mutants of the COVID-19 virus. So those variants may cause the difficulty in developing the antiviral drugs and the vaccine. Okay. So in addition, nutrition obtained from our natural food is essential to moderate the immunity against the COVID-19 before and after vaccination. So many factors are identified and show the result. Those factors can affect immune response. So you may consider how to improve your life, I mean, in a regular type. And you may control your personal environmental condition to increase your immunity and to prevent the further infection, okay? Indeed, your life behavior strategy by processing some moderate intensity activity are suitable for preventing the COVID-19 infection. Some prolonged or the deep intense exercise is not suitable for increased immunity. So moderate is good for the behavior change, okay, during the vaccination. So most importantly, using a simple way to increase the antiviral immunity is to make the healthy food in your daily life. Experts will recommend healthy food and to eat and announce what things to avoid before and after vaccination. The most important is to keep your personal immunity and keep the personal immune response until the next infection, okay? Because we note we received the vaccine to induce some immune activation. The immune memory can provide the long-term effect until we receive the different type of the virus. However, you know, the next generation of vaccine will be developed for future prevention, okay? So as you know, vaccination is protective, okay? And however, vaccine are not always available to all countries. I mean, it is not used for all people at a short time. So for example, until now, only a few countries received the complete vaccination during the COVID-19 pandemic. So I hope maybe you can know much about the vaccine knowledge and the vaccine information, and you got the chance to take the vaccination, you should take, and to receive the artificial activate immunity to prevent the disease, okay, happen. So thank you for your attention. Yeah, thank you.
Okay. Thank you for your nice presentation. See you Finland HID. Okay, ladies and gentlemen and participants, now we are moving to the question and answer or Q&A session. So now we will have 15 minutes to Q&A session. So for you participants who would like to ask for the speaker, please, you may write or ask direct to the speakers. The important thing to you have to propose to whom you may propose the question. For example, like to the first speaker or the second speaker. Okay, in the moment we have a question. I would like to take from the chat box. Okay, this question is proposed to the first speaker. During the COVID-19 or coronavirus pandemic, we usually use simulation video virtual for teaching skills, exactly for the student of nursing. However, we think that this method is a very lack of result comparing to the actual practice. Ajahn, what do you think about this? Because everything conducted by online. Ajahn.
Tidak ada alasan.
Hello, Ajahn. Are you here? Okay, let's skip it first. Now is going to the next question. It is proposed to the second speaker. Anyway, the new COVID-19 variant keep emerging and we still don't know how much about it. What are the best response for the new variant of coronavirus 2019?
Yeah, thank you for the questions. Okay. Yeah, I think it's a very interesting question and a very important question. We know there are so many variants have identified currently, okay? And so we need some strategy to monitor the current mutation in your pandemic regions. For example, if you develop some strategy to monitor the potential mutation, you will know much about the information happen now. So for the vaccine, actually, the scientists are currently testing whether the available vaccine also provide the prevention against the new variants. So it's quite important. We hope that the designed vaccine can use so commonly to prevent all the variants. However, as you know, there are some new case, new outbreak. That means there are some vaccine cannot protect all of the mutant virus. So that will make more difficulty to prevent it. So I mean, before the common vaccine or common more effective vaccine available. So personal or the social prevention are still need to prevent the further infection. Okay, that is quite important for control the environmental infection. So we still keep some information to monitor the new variant in some countries, and in all countries actually used to develop the advanced monitoring system to identify the new mutants. Okay, not just waiting for some case from the outbreak and that will make it more difficult to control the mutant in your country. So monitor system is quite important about that. Okay, that is my answer about that. Yeah, thank you.
Okay, thank you. Hope the answer will answer the question. Excuse me, Ajahn Sepapat, are you here?
Yeah, about the next question about how to increase the vaccine coverage. Actually, you know, the media, the social media is quite important to educate people. So what is the efficacy of the vaccination? So people are not getting the vaccine because they are afraid some of the adverse or some side effect because they did not provide enough information. So as I know, actually, we need to educate the people, students, and the parents what the efficacy of the vaccination. So of course, we should take some consideration. What kind of the population should receive the vaccine first? Okay, you can show the vaccination orders for all the people, and tell them the vaccine can reduce the such disease progression and the mortality according to the experience from other country or the clinical trial. So we should provide the correct information about that and educate people to receive the vaccine quickly, okay? And to increase the coverage, actually, it needs the government help because it needs the much resource to help the vaccination. So it's quite important for the country to cover all of the vaccination. Okay, so that is my comment about that. Yeah, thank you.
Okay, thank you. Okay, for the next question, please. Excuse me, Ajahn Sepapat, are you here? Okay, let now. Maybe I'm interesting to ask for the second speaker. Do you think vaccination is effective to reduce coronavirus in the third wave? Because maybe community are lazy to do like health protocol. For example, like not doing social distancing or others. Do you think that vaccine is effective to reduce the coronavirus in the third wave?
Yeah. Could you, pardon, maybe I missed some information about the corrections. So you mean whether the vaccine is effective in community? Yeah, could you have some more information about the correction? Yeah, thank you.
Oh, yeah, okay. Okay, thank you. Audience, we still have a time to ask a question to the speakers.
I think I have one question, Mr. Moderator.
Okay.
I want to ask Professor Lin Sopong. So as we know that for now, there are many commercial brand of the vaccine provided for the vaccination process in many countries. Is it, I want to know about your opinion about actually which kind of vaccine that have more effective to prevent us from the COVID-19 infection. As we know that the vaccine made from many kinds of material from the virus, as well as the full virus itself. So what is your opinion about this?
Yeah, okay, thank you. Your question, Dia. Okay, so about the vaccine type selection, actually, as you know, so many bio company developed a different strategy to develop the different type of vaccine. Okay, so all of the vaccine are designed based on their targeting. Okay, so for spike, as you know, this is generated because based on the spike protein is required for the virus attachment. Okay, onto the cell surface. Okay. So we know we should develop the vaccine to generate the antibody to neutralize the spike and to prevent the viral entry. All right. So the antibody can be generated indeed based on the bio company's data before the vaccination are commercialized. Okay, so they provide a very strong evidence that to report that they can induce very strong antibody titers. But how is its protection? How is its efficacy to neutralize the virus? Of course, they also provide the neutralization titers. And to me, actually, for immune response, we hope we can generate so many different type of antibody, not only the spike. The surface of the coronavirus maybe also provide some different component. Okay, so although we know there are some very specialized region expressed in the spike protein, so-called the receptor binding domain, so-called RBD domain. So many bio companies just detect the antibody against the RBD epitope. But do you think it's enough or we need more antibodies? Okay, according to the science paper talk about from the discovered case, okay, they analyzed the antibody types. They found in recovery case, they generate a lot of antibody to bind the whole spike, maybe whole viral surface. So that means in human, we should learn how to define the protective antibodies. Okay, I should say antibodies, because we know much about the more antibodies we can generate to stop the infection. So in my opinion, of course, if we got some a safe whole agent vaccine is quite to fit the natural infection, That is what I want to say. If I can choose, I hope maybe we should develop some kind of the whole agent, whole pathogen-based vaccine. But for the emerging case, okay, so targeting spike protein, to speed the vaccine development. Now we develop the nucleic acid vaccine, mRNA. It's quite easy to handle and the rapid response to the different variants. Okay, so it is a strategy to use the rapid developed the vaccine, such as mRNA. So as you know, mRNA vaccine cannot be used for generating whole agent, whole genome of the pathogen. So I think it's a different strategy by using the different vaccine. All right. So in the coming future, we hope we should have a very, very comparable and the most effective vaccine to be chosen. Okay, before the vaccination. Okay, so people can choose what kind of vaccine we can take. Okay, thank you for your question.
Thank you, Dr. Lee.
Okay, thank you. Hope it's answer your question, Ms. Dia. Okay, for the next question, it is proposed to the second speaker. What do you think about the condition to make 100% offline school? Is it okay after we got maybe 90% coverage of vaccines?
Okay, yeah, it's a huge question about the policies. Okay, moderated by your country guideline. Actually, in Taiwan, actually, we already have a regular education schedule, because there are some situation we take very, very consider I mean, the very, very remarkable regulation. So we know where is the infected case and what's the infectivity rate of this outbreak. So, and the vaccination coverage over 75% in the government. They said that they were allowed to pass the normal schedule of the semester. So hopefully, I think that the different countries show the different situation. So that depends on the microbial monitoring system. Okay, if you can provide a very, very update and very rapid information about the possible infection case, I think that is possible to recover all of the school life. Okay, so I think the 90% coverage of the vaccine is a very nice goal for the society. Yeah, but you know, the virus variant are existed. So the possible outbreak is also possible to develop. So the most important is about the information. So is any monitoring system in your country? If yes, of course you can control very, very well. Okay, that's my answer about that. Yeah, thank you.
Okay, thank you. Ms. Mika, hope it answers your question. Okay, for the next question, it's proposed to the second speaker. In the era of the new variant of coronavirus 2019, if there are people who cannot be vaccinated because of a certain diseases, how can herd immunity be formed? Just from accessing a wearing mask, or is there another way? What is your opinion, sir?
Yeah, thank you. Yeah, herd immunity is quite final goal after vaccination. Okay, but you know the mutation is progressed so quickly. So indeed, it's difficult to have a very well established herd immunity. But you know, in immunology, we talk about the social immunity. We can provide some prevention from the natural infection or the artificial immunization. So of course, the mask is a quite simple, quite easy methods to prevent the personal infection, I believe. Because according to the real data, you know, not only the COVID-19, but also I showed a slide talk about the pneumonia, severe case in Taiwan, totally reduced. That means through the respiratory or some contact infection was totally reduced after the mask, the profits. So I think the personal healthy monitoring condition is quite important to prevent some kind of the infection. Of course, in the future, we should have more drug development. You know, there are some drugs talk about they can reduce the disease progression. So in the near future, maybe we have a very nice treatable drug can be used in clinical, just like the influenza, you know, the Tamiflu just reduce, they cannot block the infection, but they reduce the disease progression. So in the future, we believe that we should have some potential drug can be used in clinical. Okay, so I hope maybe we don't have the vaccination, but we still can keep the safe because the medication. Okay, yeah, thank you.
Yes, thank you. So, ladies and gentlemen, this all the session of Q&A. So now moving to the next session, that is certificate delivery. That will be delivered by the chairman for Mr. Andi Yudianto, Master of Public Health. The time is available.
Okay. Thanks. For Assistant Professor Dr. Spapax Petra Swan and Professor Jiu Feng Li, PhD, thank you for your support to be our event, and we did it. for you. And the certificate sent by email. Thank you.
Okay, thank you very much, sir.
Thank you. So the certificate for Assistant Professor Dr. Supapak. Okay, this is for Dr. Supapak's one.
Thank you very much.
So this, and for Prof. Chief Fengling. Thank you.
Yeah. Thank you so much. Thank you.
Okay, good. Okay, take a picture for this moment. Okay, next for Prof. Chiu Fengling. For operator, take it. Okay.
Yeah, thank you.
Okay, finish. Thank you for moderator.
Okay. Ladies and gentlemen, and all the participants and the respectable speakers, I think that's all the presentation for the first session. I am as the moderator for this presentation. Please pardon me if I did many mistakes during the presentation or the agenda. And now I am back to the main moderator from Mr. Angga Miftahul, Master of Nursing. The time is yours. Thank you very much.
Thank you, Mr. Sahiri. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. So glad to meet you today. On this occasion, allow me to introduce myself. I'm Angga Miftahul Nizar from Hutama Abdi Nursing Academy Indonesia. Today is a very happy opportunity for me because I have the honor of being one of the moderator of the extraordinary activity of the Third Joint International Conference 2021. On this session, I will guide to you to the course of the activities in the third and the fourth main session. With the main topic, it's about the family and community resilience during COVID-19 and also about the immune response after COVID-19 vaccination. Distinguished guests, ladies and gentlemen, we know that the COVID-19 still is a problem in the worldwide, particularly in Indonesia. There are many impacts of COVID-19 attacks, such as in the health facilities, social facilities, and also the economic facilities and the psychological activities. Our researchers still try now with a high effort to finding a solution to overcome this COVID-19 pandemic. In this session, we will discuss about the strategies to improve family and community resilience in the face of the COVID-19 pandemic. And also, we're talking about the immune response after COVID-19 vaccination. Distinguished guests, ladies and gentlemen, for this session, we have two speakers in the quick moment. For the first speaker is Mr. Dr. Nurse Muhammad Fukul Huda, MCAP SPCOM from Karya Husada Nursing Academy Indonesia. And for the second presenter, we have Mrs. IIK Krishnawati, ASCAP Nurse MPSI PhD from Dharma Husada Nursing Academy. Distinguished guests, ladies and gentlemen, before I start in this discussion, I will share for you about the term of this session. For the first session, we divided into two sessions. For the first, its material delivered from the first expert, around 30 minutes, and will continue to the second presenter. After finish that, we are going to the question and answer session, around 10 minutes. For the distinguished guests, ladies and gentlemen, we will start on the first agenda with the material strategies to improve family and community resilience to face in the COVID-19 pandemic, who delivered from Dr. Nurse Muhammad Fukul Huda, MCAP SPCOM from Karya Husada Nursing Academy, Indonesia. Before we start our discussion, I would like you to share about the curriculum vitae from Dr. Muhammad Fukul Huda. Dr. Nurse Muhammad Fukul Huda, SKP, MCAP, SPCOM, as a lecturer from STIKES Karya Husada Pare. From the educational background, he graduated from the Bachelor of Nursing program on the Faculty of Medicine, Universitas Padjadjaran Bandung, and he graduated from the Magister of Nursing Science from the Faculty of Nursing, Indonesia University, Jakarta, and also in the Nursing Specialist of Community program. And then he continued in the doctoral program of Medical Science in the Medical Faculty of Undip. And then from the professional experience, from the first, from Mr. Dr. Muhammad Fukul Huda, is a head of the study Bachelor of Nursing program in the STIKES Karya Husada Kediri, and also team expert nurse training for PPNI, GPW Community Nursing Collegium, is Java Province on the Health Office. And then as a assessor team in the LAMPTEKES. So for the first presenter, for the Dr. Muhammad Fukul Huda. Hello, Dr. Muhammad Fukul Huda, are you there?
Yes.
How are you today, Dr. Muhammad Fukul Huda? Okay, I hope you always be healthy, Dr. Muhammad Fukul Huda. Are you ready to start your presentation, Doctor? Okay, you can start your presentation if you are in the ready position. And this floor is yours now, Mr. Dr. Muhammad Fukul Huda.
Okay, thank you. Mr. Adam Mr. of Nursing. Assalamualaikum warahmatullahi wabarakatuh. Good morning. I'm sorry.
I'm so sorry. From the first presenter, Dr. Muhammad Fukul Huda, your voice is not clear. I think you can repair with your voice and your connector on cable, or maybe you can check your internet connection.
Hello, can you hear me? Check.
Okay, Mister, it's more clear than before. Please start again your presentation.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning. Our responsibility for speaker and our participant is me to present strategies to promote income in the face of the COVID-19 pandemic. Okay, the first COVID-19 case data on March 2022 got 2 cases. And then the same at the same time too, and more in the next one are in 5,712.
Excuse me, Dr. Muhammad Fukul Huda.
After one year, not 21, or healing at 2,904 cases. While the data of 119 free okay. Impact of COVID-19 for family and community, arts, education, economic, and environment. And what is family and community? The ability of families and communities to rise from shock and absorb disturbance while still maintaining their basic function. What is the family community? Family is collection of individuals due to marriage, collaboration, and adoption. A community is a collection of individuals due to common needs, risk of problem, desire, living in the same or area. How to is resilient families and communities facing the COVID-19? First of all, use a family community approach. Second, for example, readiness to increase knowledge about COVID-19 or knowledge deficit about COVID-19.
I'm so sorry, Mr. Huda.
Yes.
Yeah. I'm so sorry, Mr. Huda.
Communication. Yes.
Yeah. I'm so sorry, Dr. Huda. I think that your voice is not clear. Maybe you can repair again with your connection.
Yeah, I will to check with my device.
Yes, maybe you can use your second option, maybe with your hotspot tethering by your phone.
Yes, I will change.
Okay, thank you, Mr. Dr. Huda. And for all the participants, you can write down your question if you have any question from the first presenter in the second session from Dr. Huda in the question and answer box. Okay, are you ready, Mr. Dr. Huda? Okay, you can continue again your presentation.
Thank you very much. Strategy for family of community education. For us, introduce ourselves. I will to lanjut. Strategi melakukan edukasi keluarga atau komunitas. Yang penting adalah memperkenalkan diri baik. Introduce ourselves. Second, inform if there are type of problem that threaten us or you persuasion, please help me about what I have to say so I can know the problem of family or community, so that I can convey to the best of my ability, not directly confiding or desire to educate about the current problem, because family and community are not empty spaces that are always ready to be fight, because they have competence, but they need to be the condition to have a common perception to be aware of existing problem. Strategy for education. For example, of step for opening education. COVID-19 has proven to be a threat to our lives. Many are getting sick and dying around us because of it.
Kalau lewat HP kedengaran tuh suara.
It's just proves that there is a problem. What are you aware of now? Give them a chance to answer brainstorming. Based on their answer, what they already know and what would like to improve to know more. The answer become a very relevant application them to increase the resilience of family and communities in the result of COVID-19. We need to remind the incident of death by age category. Pasien confirmed COVID-19 which age 90 years have the highest risk of death, especially men. Compliance level implementing alcohol. The higher it, the more obedient to the protocol. Even though the knowledge level is 85%, only 72% of the people always keep a minimum distance of 1 meter. 80% of the obedient always their hand with soap or hand sanitizer, and 80% of the people use masks. Protect effect of preventive behavior on the risk of infecting COVID-19. The most effective to reduce the risk of contracting COVID-19 are keep a minimum distance of more or less 85%, followed by wearing a surgical mask more of this 70%, wearing a cloth mask more or less 45%, washing hand with soap more or less 35%. If without prevention has a risk of 5 to 20%. Stage of internalization of new habit, thoughts, gets up to trend, become a habit, become character, and become a culture. The reason why family is important for family nurse. First of all, the family as a system of heart survives as well as individual, so it can fulfill its duties in every basis of the power. Second, the level of individual heart is closely related to the level of family and vice versa. And third, the functional level of the family as the smallest unit of the community can affect the health status of the system above it. Family or community empowerment concern for risk of COVID-19 to ability to carry out family or community function. So family community resilient. Family empowerment. Nursing intervention decide the act of optimizing the ability of family so that family members have the ability to effectively care for family members and maintain their consumption emerging to play as significant impact of family-centered nursing intervention, health promotion, action, and cultural conformity that affect treatment, action, and family development. Family empowerment intervention provide accurate and complete information about the condition of health problem or disease faced by family members, improve family care management, promote empathy, and show genuine concern, and recognize, improve family competence, caring for family members, and with direct relationship with sick family members. The family has ability to recover from shock and disturbance while maintaining basic function. Include three mean. The first, capacity to accept crushing pressure or force, third, resistant or adaptation. Capacity to manage or maintain certain basic function and structure during catastrophic event, and third, capacity to recuperate or bounce back after an incident. Family reason, the ability of an ecosystem that has experienced stress and even at origin states. The ability to survive and the ability to adapt to unexpected change and the high-risk condition. The process of adapting or coping with situations when faced with trauma, adversity, threat, tragedy, or stress. Family or community resilience is a family or community that has the capacity to adapt to condition after a shock occur. Family resilience to manage the COVID-19 pandemic after the adaptation process, maintaining basic function in society that determine the sustainability of life, as well as the ability to recover to its original state. The family adaptive capacity is a function of the family ability to tolerate experiences, use memory and experiences to learn, innovate, and recognize resources to adapt to the demand of a changing environment. Connecting others within to communicate experiences and listen to extend external resources. The family function, five family function. The one, effective, instilling the value of clean and healthy life. Second, socialization about COVID prevention, PSBB policy, or large-scale social restriction. And reproduction, about control pregnancy, economic, and healthcare ability about life as family. Healthcare function to prevent COVID-19, recognizing the problem COVID-19, decided to prevent COVID-19, caring for family member at risk of COVID-19, modifying the environment to prevent COVID-19, and utilizing health services facilities for COVID-19 detection. For intervention, make liver and heart about three prevention. Primary prevention, secondary prevention, tertiary prevention. primary prevention, about promotion, special protection or specific protection. Secondary prevention is motivating family to carry out screening tests, early diagnosis COVID-19, risk perception questionnaire, rapid test, swab test, PCR, management of symptoms of the disease that appear from treatment. Tertiary prevention, rehabilitation and limitation, disability limitation. Intervention, prevention, primary prevention is before it occurs, prevention for case being sick, for secondary prevention, and tertiary prevention for prevention after illness. The optimizing the role of family community is facing COVID-19 issue, ability to discipline or behavior of its member, educate their children to comply with the protocol set by the government, prepare and fulfill the life need of its member, instilling habit in its member to always practice a healthy lifestyle by exercising regularly, caring for the mental health of its member, motivate and strengthen its other, so that society in effort of basic units as social being. Primary prevention about health promotion and specific protection. Health promotion about the effect of COVID-19 so that it can be prevented by the family and the community. There are 4 categories of COVID-19 cases. First, suspect, second, probability, third, close contact, and fourth, confirmation. For instance of suspect case, one of the following criteria: acute respiratory infection, the last English or symptom level stay in the respective local transmission, or in the last 14 days before contact with confirmed and several acute respiratory infection, several pneumonia, no other causes. Definition probability is suspect is who died with a convincing clinical picture of COVID-19. No rapid transcription PCR polymerase chain reaction. One time was negative and no second examination was performed.
I'm so sorry, Mr. Huda.
Yes.
Yes. I'm so sorry, Dr. Huda. That's your time to presentation is less than 5 minutes again.
Okay, thank you, Ms. Sandra.
Okay, thank you.
For being with COVID-19 evidence by lab examination, and then close contact is contact story with probable confirmed case COVID-19, promotional and preventive effort about washing, useness, awareness, motivation, body immunity increase, and discount for culture and new habit. This promotion race, for physical spiritual health promotion. You have the test prevention about specific protection, the importance of complete vaccine COVID-19, prevent the risk of symptomatic COVID-19 due to vaccine. Management of COVID-19 patient without symptom pharmacology with vitamin and all for family member with COVID-19, no symptom to self-isolation at home, symptom self-isolation at home, 10 days and the onset of symptom as 3 days in the day. Refer to emergency hospital. For symptom, refer to referral hospital. Continue to self-isolated for 7 days. Then, care AKPER disease may require home care. To recommend that patient continue to communicate with healthcare provider or public health authorities during the period of home care. Until symptom resolve, care for health worker must wearing a mask and extra. Compare the active family member short. Inform of the type of treatment to be taken and the use of available protection to cover nose and mouth.
Waalaikumsalam. Ini lagi ke conference.
Tertiary prevention. Terus nih rule kriteria
diterima
from to January 2020 Austrian, the case spread in China. The website in number of countries, the capacity of swab test is still limited, so it's more utilized for the first test. After recovery, can it be vaccinated? It is recommended to stay vaccinated to prevent transmission of the virus because even though healing, still risk of reinfecting the information immunity or natural immunity forever. The time of the formation of the virus. And conclusion, COVID-19 is a global infection disease is cure. COVID transmission can be prevented with transport of sector good and cognitive, promotive, preventive, or inform education and traffic. For like this, in the COVID-19 prevention protocol, family and communities as the front line of prevention of COVID-19 need to be optimally empowered through the involvement of family, cater, community leader, regional leader, and so that a new culture is formed. So thank you for your attention. And then to Mr. Angga.
Okay, thank you, Dr. Huda, from your best presenter today. And I think that this material is very clear. And then for all of the participants who have a question for this session, please write down your question in the chat box. And then don't forget to mention your name and also your institution. And if you want to ask for our speaker directly, maybe you can give me voice that something like you can press the raise hand button, and the committee will give you access to speak what for your question spontaneously. Okay, thank you, Mr. Huda. We are going to for the next presenter. For the next presenter, ladies and gentlemen, we will start for the second agenda with the material immune response for after COVID-19 vaccination, we delivered from Mrs. IIK Krishnawati as Governess MSI PhD around 30 minutes. Before we start our discussion, I would like to you about the information from the curriculum vitae from Mrs. IIK Krishnawati. Nastia Ika Krishnawati as MSI PhD as a lecturer from the Dharma Husada Nursing Academy Kediri, East Java, Indonesia. From the educational background, she graduated from the bachelor degree S1, including residence program in the nursing program, medicine faculty of Brawijaya University, and then continue in the master degree in the medical science, majoring on Psychology Medicine Faculty of Erlangga University, Surabaya, East Java. And then she continued in the PhD program in Graduate Institute of Medical Science, Taipei Medical University. And also, Mrs. Dia Ika as a lecturer in Dharma Husada Nursing Academy Kediri, East Java. For Mrs. Dia Ika, hello.
Hello, yes, I'm here.
Yes, are you ready for your presentation, Mrs. Dia Ika?
Yeah.
Yes. Before we start, how are you today, Mrs. Dia? Are you okay?
Alhamdulillah.
Alhamdulillah. Okay. If you are ready now, you can start your presentation right now, Mrs. Dia.
Okay. So, Mr. Angga, can you hear my voice clearly?
Yes, Mrs. Dia, I can hear your voice clearly.
Okay, so I can share my PPT now. You can see that?
Yes, I can see your PPT.
Okay, thank you. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh. It is my great honor, and I would like to thank to the organizing committee to invite me on this webinar today. So like mentioned in the agenda, this time I would like to share about what's a little bit something I knew about the immune response, especially because now we are on the COVID-19 pandemic. So maybe in this time we can discuss about the immune response after we got the COVID-19 vaccination. So for the introduction, maybe as we know that the immunization is the process that really important for our immune system because it can help our body to defend to any kinds of germs or the pathogen attacks to our body. And usually to protect this protection activity is we use the vaccination process. So the vaccination process is the process that can train our immune system to face the many kinds of pathogen or we can say that intruder that come to our body. So we cannot get or we will not get into sick or infection condition, even though we got the infection from many kinds of pathogen. So actually, normally in the immune cell will depend in our body, such as a bacteria, virus, and other pathogen. And our immune cell actually constantly there will be circulating throughout our body to monitor whether there is like the foreign molecules that come to our body. The foreign molecule usually we call the antigen. So in here we will talking about the antigen and what is the antigen effects or response after it binding with our immune cells. Normally, usually our immune cell will ignore the many antigen from the normal cell, but if there is some intruder molecule or virus or pathogen come to our body, and they will present the antigen of their body. So our immune system will respond at the beginning. That maybe we are here already know about the phagocytosis process, and also we know about the killing activity of the cytotoxic T cell, and as well as maybe the neutralizing activity of the antibody. So for now, about the vaccine platform, I got this cartoon from the vaccine tracker organization website. So there are many kind of vaccine platform designed to train our immune system. So like my question previously to Professor Lim, because there are many kinds of material that the company made the company used to make the vaccine. So we're still asking until now how effective is in every kinds of the vaccine material. So in here, the vaccine tracker say that the vaccine platform can made by two types of the material. The first one is the types of component of the viral vaccine. It can be from the protein subunit, which is already isolated and purified from the viral protein. Also maybe from the virus-like particle of VLP, and then the newest vaccine model material. Now we use the DNA and RNA based vaccine, and also the non-replicating as well as the replicating viral factor. And the second type is types of whole virus vaccine. So it can be two types of it: the inactivated virus, and the next one is the live attenuated virus. So I concerned about the effectivity of the vaccine, because if we if we compare between if we use the whole virus to make the vaccine, comparing with the components of the viral vaccine material, we can imagine that because of the whole vaccine have many kinds of receptor in the surface of the virus, so that will be more antibody may be needed to clearance the virus later. Okay, so this all material will be provide as the antigen. So if we put this antigen inside our body by through the shot of the vaccine, so the antibody of the COVID-19 will become to our body, and that will be induce our immune response. So this flow chart I made. I think it will make us easier to understand about how our immune system response, or our immune system will be response to the foreign intruder. So in here, actually, we have two kinds of it: the innate immune and adaptive immune. And actually, before the pathogen come to the innate immune, actually, we already have the chemical and physical barrier, such as the lysozyme in our tears, and then maybe the cilia in our respiratory tract, and also maybe the acidic pH in our stomach. That will be the first defense mechanism of our immune response, actually. But if the pathogen can pass through this chemical and physical barrier, they will face with the innate immune response. And here we have the inflammation process, which is including the macrophage and neutrophil, and also the interferon, which is the interferon can interfering the viral infection, and then also can activate the complement system with the plasma protein activation, as well as if the virus can make our cell becoming really bad, and it become to the cancer cell. So we actually have the natural killer cell to clearance the cancer cell inside our body. So actually, if we got the vaccine, actually the antigen first will be faced with this, the macrophage and the friend of macrophage, the dendritic cell, and the macrophage will be do like engulfing. The macrophage will eat the antigen, and then they will make like the consideration whether this one is virus or bacteria. something like that. And then the macrophages will come to the nearby peripheral lymphoid tissues we have, such as the tonsil, and then the spleen, and then the Peyer's patch, and our lymphatic system. Those peripheral lymphoid tissues has many kinds of cells that related to adaptive immune response. So after that, if the innate immune response cannot clear the infection, so our immune response will come to the adaptive immune response, which we will with the pathogen will contact with the lymphocyte B, T lymphocyte, B lymphocyte, and T lymphocyte here. So in adaptive immune response, we have two kinds: the humoral immunity and the cell-mediated immune response. Okay, so in the humoral antibody, maybe people, when people talking about vaccination, everybody already talking about the antibody. So this is the cell that can produce the antibody actually in the adaptive immune response, in the humoral immunity, which is in humoral immunity has the B lymphocyte that can produce the plasma cell. This plasma cell is the factory of the antibody production. So in here, the antibody can be produced. Yeah, and beside that also, the B lymphocyte also will make the memory cell. It can be prevent us from the second attack and so on. And beside that also, the cell-mediated immunity will be responded. Yeah. It will be included the cytotoxic T cell and helper T cell. As we know that helper T cell is a kind of immune cell that help every immune cell. So helper T cell can activate the B cell, can activate the macrophage, can activate many kinds of immune cell. Also, the helper T cell can give the recharge energy if sometimes there are so many bad battle between our immune and the pathogen, and maybe our immune cell already feeling so exhausted with that battle. So helper T cell will come and recharge their energy. So this is the helper T cell do during the battle between our immune system and the pathogen. And what does the cytotoxic T cell do? Yeah, so that cytotoxic T cell doing like the killing activity. So, which cell will be killed by the cytotoxic T cell? Cytotoxic T cell will kill the pathogen itself. The first one is the pathogen itself, and then the second one is the infected cell. So, if our body infected by a kind of a pathogen, yeah, it will be killed by the infected cell. So it will be killed by the cytotoxic T cell. In order to, when the virus already copy the machinery inside our body cell, so it will stop the process. So there will be no more pathogen, no more virus, no more bacteria produced or proliferate later. So this is what happened in our immune. This is what happened in our immune system. So basically, actually, the vaccine will be effective. The vaccine actually will be recruited this immune response. In here, after vaccinated, we already have the memory cell, the memory cell of the memory cell of B lymphocyte, as well as the memory cell of T lymphocyte. So when sometimes we attacked by the COVID-19 virus, so we already have the weapon. We already have the plasma cell who produce the antibody. So from the beginning of the attackment of the pathogen, the antibody already could be produced. So hopefully the infection will be cleared soon. So let me take a look about the humoral immunity more. So like I stated before, that after vaccinated, we already have the B cell in our B cell with B cell that recognize the special antigen from the bacteria or pathogen inside the vaccine as the material of the vaccine. So after we already vaccinated, if we got the infection, so it will be easier to the B cell to activate and then produce the plasma cell and another memory cell, and will produce antibody in the same days of infection. And as and here that memory cell is a long life cell, so it can be stored, yeah, in our peripheral lymphoid tissues in long time, maybe forever, maybe forever. But for the special things that we need to recognize here, that one antibody only have one specificity to one antigen. So like Professor Lin said that now COVID-19 already mutated to many kinds of variants. So yeah, many people asking me, so we have to do like many kinds of vaccination. And according to this explanation, I just can say yes, because if we just have one kind of vaccination, that means our body just have memory cell for one kind of antigen of one variant of COVID-19. So that's why for our maybe for our health worker today, they have the booster with another type of another variant of COVID-19. I think this is a good one. Yeah. Okay, so how the antibody works? Yeah, so how the antibody works to clearance the pathogen. So at first, antibody use the neutralization function. How it works? So in here, if there is a pathogen come to our body, the antibody will be surrounding the pathogen, so it will be make the pathogen cannot attach the target tissue or our healthy cells, so that the infection will not happen, will not occurring the infection in there. And then the second one, the antibody can do the agglutination process. Let's say that this antibody function as a glue, so it can make the pathogens, many pathogens clumps together, so they cannot attach the target tissue. And then the third one, the antibody responses, it can be enhanced the phagocytosis. As we know that phagocytosis was done by the macrophages, so it will make the macrophage easier to recognize there is something wrong, there is something that not normal, that I need to clearance, just like something like that. So will make easier the macrophage to eat the pathogen if they already surrounded by the antibody. And then the next one, antibody also can activate the complement system. So complement system will work directly to the pathogen body, Usually this one is to the bigger pathogen like bacteria. So after the pathogen attacks our body, the antibody will bind with the surface of the pathogen, and then will activate the MAC, membrane attached complex, that can be occurring a pore, the open pore, and then will make many kinds of maybe ions or water rush into the pathogen body. So it will make the pathogen body becoming bigger and bigger, and then it bursts. It's just like when we put more water inside a balloon. If we put the water again and again, and it will make the balloon blown up, and then the pathogen will be dead. And the next one, last one, for the antibody response is it can be stimulate the natural killer. Actually, this is related to the abnormal body cell. For example, if our cell already infected by viral, that can be occurring the mutation of the healthy cell into the cancer cell, for example. The antibody can recognize this abnormal cell and then attacks the surface of the abnormal cell, and then it will call the natural killer cell to come. And then natural killer will perform or produce the buffer and fragmentin to kill the abnormal body cell. So this is the antibody response. So we can imagine now that if we already vaccinated, we already immunized, and our body already have already have the memory cells of this antigen. So when there is attack from the virus, for example, COVID-19, so the antibody can be produced in the same day of the infection. Okay, so briefly speaking about how to activate the helper T cell and the B cell and T cell, I will talking maybe very fast here because yeah. So if our body already attacked by the foreign body, let's say it's a germ, it's a pathogen, it's a virus, yeah. So it will be encoding at first in our innate immune response that will be eaten by the macrophage, and then the macrophage will present the antigen of the intruder in the surface of the macrophage, and it's called the antigen presenting cell. So this cell was present the antibody, and it will be recognized by helper T cell. Helper T cell will bind with the helper T cell receptor. Will bind this antigen presenting antigen that present by the macrophage, and after that the helper T cell will be activated and then come to the peripheral lymphoid tissue to activate the and also produce many kinds of cytokines that can activate the B cell and the T cell. The B cell will produce plasma cell and memory cell. Plasma cell will produce the antibody, and then the cytotoxic T cell will do the killing activity. Yeah, cytotoxic T cell will kill the infected cells as well as the bacteria or pathogen or virus. So here I want to show the differences between the immune response to viral infection before and after immunized. So I stated before that after we got the vaccinated, the antibody will be produced in the days in the same days, even in the first days of the infection of bacteria. We can see here that the upper figure shown us the condition of our immune response before we got the vaccination, and the below diagram show us about the condition after we got the vaccination. We just can compare the early the cellular response. So before we got the vaccination, the process is always begin from the innate immune response. In here, we need to pass through the innate immune response. But if we have the vaccination, we don't need to pass through the innate immune response because we already have the memory cell. Remember, okay. And then we can compare also about the cellular response. So we can see in the upper picture, we can see the cellular response will be occurring after 6 days. But in the below picture, we can see that the cellular response will be increasing directly in the first day of the infection. So it will make us easier to clearance the bacteria. And also we can see the antibody response here. So the antibody first, before vaccination, the antibody will be occurring after 8 days of the infection. And I just imagine here if the antibody is occurring in the 8 days after infection. So what happened in the day 1 until 7? I think these people will suffering many kinds of sign and symptom. Sign of symptom of the infection. And in the below picture, we can see that antibody response also directly occurring from the first day of infection. And we know that the number of antibody also higher, production. Antibody production also higher comparing with the people who don't get the vaccination. This is the differences, between the people who got the vaccine or no. So before I end my talk, a couple days ago, I checked Google to know about the immunization covered in Indonesian people. So I got the information if the immunization covered in Indonesia until now is still below than 50%, according to the news that I read at that time. So I think this is a great job, a big job, still become a big job for us as the health worker to give motivation to people to come to the maybe hospital or the puskesmas to do some vaccination, because it's really important to reduce the case of the COVID-19 and also to pass through this pandemic. Yeah, maybe that's for me. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you. I think that between two speakers in this session, both of them give very clear materials. Thank you so much for the both of them, for the first presenter and also for the second speaker. Ladies and gentlemen, that's all for the first session. Now we are going to the next session. It's called the question and answer session. For the question and answer session, for the first, we will give one question to each presenter. Before asking, please state your name and institution of origin. After the states of their question clearly and briefly. For the participant who have the question in this session and don't want to ask spontaneously or directly, please write down here in the chat box, and don't forget to mention your name and also your institution. I think I will check in the chat box that there is one question for the second presenter in the second session. It's from Futika Permatasari. This question for Mrs. Dia. The question is, how long COVID-19 vaccine can protect us? Should we get another doses of vaccine in the future? That's all clear, Mrs. Dia?
Yeah.
Yeah, maybe you can answer that right now.
Okay, thank you for the question. Okay, like I stated before, that the immune cell that produces the antibody is the plasma cell. The plasma cell. But we already after we have the infection, the plasma cell will produce many of antibody to clearance the pathogen, right? But the plasma cell production will be end by the time. But remember, we still have the memory cell. So if the memory cell will be stay behind in our body forever, like forever. So if we have the second attack, the third attack, the fourth attack from the same antigen. I said for the same antigen, there will be a memory cell ready to produce more antibody again. Yeah, but if the COVID-19 antigen that attacks us in the next round is the different antigen, has the different antigen, it's mean from the different variant. So in here we have another process in our immune. So it will begin the response will be begin again from the innate immune response. That's why the booster of the I stated that the booster, if we got another type of a variant vaccine, that will be good. But people now sometimes will not get that because maybe they thinking about the side effect of the vaccine. Sometimes it's not really comfortable for our body as the side effect of the vaccine. But once we already have the memory cell of the similar cell, I think our immune system also can help to reduce the sign of symptom, although we got the infection from another variant. I hope it answered.
Okay, thank you, Ms. Tia. I think that your statement is very answer this question. And we continue with the second question from Mrs. Indah. This question is for Mr. Huda. Mr. Huda, are you there? Okay, I will read the question, Mr. Huda. For this question is from Mrs. Indah. How is it technical to provide assistance for families and so they can be resilient? This question is clear, Mr. Huda? Okay, thank you. The time is yours, Mr. Huda.
Thank you for the question, Mrs. Enda. How to strategy for Asian family. Okay, I need to explain the strategy for family for resilient. First of all, is introduce yourself for if there are fact or problem that threaten us or do procession, please help me about what I have to say so that I can know the problem of family community, so that I can contribute to the best of my ability. Remember, not directly confining our direction to educate about the current problem, because family and there are not infinite space that always to do right, because that's competent, but they need to be better condition to have a common perception to be well access that problem. For example, step for education, you get to explain COVID-19 has proven to be a threat to our life. Many are getting sick and dying around us because of it. If you don't feel realize this is a joint risk, is just for that there is a problem. What are you aware of? What are you aware of now? Given them a change to answer brainstorming based on their answer, what they are already know and what they would like to improve to know more. The answer become a very relevant educational them to increase the resilience of family or in the COVID-19. Thank you.
Thank you, Dr. Matfukul Huda, for your answer. It's very clear. And we continue with the next question. The question is from Sri Utami, Mrs. Sri Utami. And the question to Ms. Dia, from the question, how much is the third vaccine needed for our body? And what is different in function in the body among Sinovac vaccine, Pfizer, and Moderna? Maybe you can give your comment about this problem, Mrs. Dia.
Yeah, thank you for the question, Sri Utami. This is very good question, and it's already make a concern for me as well about the many kinds of vaccine that provided from many kinds of brand and the industry. So about the question about how much is the third vaccine needed for our body, actually, it's depend on in our immune response. If our immune response is in the good condition when we got the vaccine, I think our body will get enough memory cell to store. Yeah, will have enough memory cell to store. That will be have a big benefit for our body. And about the many kinds of vaccine brand, I think actually our concerns is should be not in the brand, but in the material inside the vaccine. So like I stated before in my cartoon that there are many kinds of many type of the material of the vaccine from the made from the viruses. It can be from the component of the viruses, and also it can be from the whole virus. Yeah. If I imagine that if we got the vaccine from the whole virus, there will be more antibody in it, because whole virus will have many kinds of receptor in the surface of the virus. So there will be need more antibody to neutralize that. But if the vaccine material is just come from the particle or the part of the body of the virus body, that will be maybe that will be need less antibody needed to store to give the immune response, but it can be enough to produce the memory cells. Yeah, so that's my opinion.
Thank you, Mrs. Jia. And then we are going to for the next question. It's still for Mrs. Jia, from Mr. Zauhani. And the question is about, we know that immune response can cause double impact to our body. We need a strong immune response to protect ourselves, but if the response is over, it can be harm, and it's danger too, like the cytokine storm condition on COVID-19 patient. So, how to measure an appropriate immune response to fix our health problem for these issues? Thank you. Maybe you can answer directly.
Yes.
Yeah.
Yeah. Thank you. This is an interesting question, and I agree that this COVID-19 really have a very harm effect to our body, such as a cytokine storm. Why is it happen? Because actually it's also happen in every infection of the bacterial or virus, because in the first stage of our immune response is inflammation. So this inflammation happen, it also depend in our immune status. If our immune status was in the good condition when we are attacked by the virus, so probably the inflammation process will be have the lower effect to our body. So why the COVID-19 infection is so can make so severe infection? Because it's the receptor of this virus. I think in my opinion, because of the receptor of this virus is in the respiratory tract. Yeah, as we know that respiratory tract is very important for our body, because via the respiratory tract we can produce inhale the oxygen, which is all our body cell need oxygen for their metabolism. So if we can compare if another organ was attacked by the virus, that will be not have effect to the oxygen condition, oxygen level in our body. But the COVID-19 attacks our respiratory tract, which is it's really important for our body to get the oxygen for nutrition for every single cell in our body. So that will make the immunity of people who attacked by the virus COVID-19 will be decreased very fast. Yeah, very fast. Besides, they need to maintain their immune system. Our body also should maintain the bacterial virus infection of COVID-19. That's why it's the difference with other virus attacks, in my opinion. And how to measure the appropriate immune response? We can measure the immune response by many kinds of symptoms that occurring during the infection process. Maybe for COVID-19, we can see for the breathless condition, how severe is it, and then the fever, how long we got the fever, and then the weakness of the body, how weak the people who attacked by this who got this infection also can mention about the measurement of the appropriate immune response in our health program. Yeah, that's my opinion.
Okay, thank you, Ms. Tia. Ladies and gentlemen, I think that for this session, the time is over. The operator just contact me to say that this time is over. So we can was that something like share with you about the next question. I'm so sorry. Maybe for the next question, you can make it for the next presenter or speaker. Okay, ladies and gentlemen, for the next session, we just finished in the 2 sessions, in the 4th and the 3rd session. And then for the continue in the session, I will give you certain information about the third Joint International Conference 2021 with the theme of the After COVID-19 Pandemic, Health and Education System Resilience. This conference presented by the AIDS institution is Java and will be held on the 2 days, and the 17th and the 18th November 2021. Don't forget that tomorrow is more important day because there are moments for all the participants can express and share for you about your research, especially in the health results. For all of the participants who have joined as a presenter, please give the best presentation of you tomorrow, and hope you two will be the best participant and the presenter. Okay, the distinguished guests, ladies and gentlemen, we are going to for the next session, the certificate delivery. For the certificate delivered by a Dean of Health Science Faculty of Universitas Darul Ulum Jombang, for Mrs. Pujiani Mkes, this floor is yours. Excuse me, Mrs. Pujiani.
Kak Muni. Okay. Thank you so much for your support to become our speakers, and we hope we can collaborate in the next event. Pak Huda, yeah. Okay. Speaker 2. Speaker 2, Budiah Ika Krisnawati.
Thank you.
Thank you for Mrs. Pujiani Mkes as Dean of the Faculty of Health Science from Universitas Darul Ulum Jombang. And we continue for the next session. Thank you so much for all of the participants, and extremely grateful from our speaker in this session, Dr. Nas Muhammad Fugul Huda, MKAP SPCOM for Karya Husada Nursing Academy Indonesia. And then the second presenter, Mrs. Dia Ika Krisnawati, SKPNAS MSI PhD from Dharma Nursing Academy. Thank you so much as your presentation and the great material for today. Distinguished guests, ladies and gentlemen, that was the third and the fourth session on the today occasion. I ask a moderator, apologize if there are words there are less pleasing in guiding in this discussion. Thank you for your warmest attention. Have a nice day and see you in the next session. Assalamualaikum warahmatullahi wabarakatuh. I will give back this floor to the Master of Ceremony.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mr. Angga Miftahul Nizar and Cubs for handling these sessions. I'm sure, and also all of us, all participants are very sure that we have had the fruitful discussions today's sessions. Dear participants, ladies and gentlemen, before we are going to have the play session, there are some information that I should share. The first is about, we would like to remind you and all participants to fill in the evaluation sheet for each speaker that in the Google form that the link has been sent to you for the 4 speakers. Speaker 1 is for Assistant Professor Dr. Papat Petraswan from Mahidol University of Thailand. Speakers 2 is for Prof. Chol Feng Lin, PhD from Taipei Medical University, Taiwan. The speaker 3 is Dr. Nes Muhammad Maftul Huda MKS PCOM from Karya Husada Indonesia. And then the speaker 4 is Dia Ika Krishnawati Eskep Nas MSc PhD from Dharma Husada Nursing. So each of the speaker will have the evaluation sheet, and don't forget to fill in the evaluation sheet. And we are going to have the break session, and we will back and meet you again at 12:30. Emil. And also that with Dr. Emil, we'll have the session. We hope that, and we will meet again at 12:30. We hope that all of us will be in the main Zoom at the time. It can be good is in time. Thank you so much. Have a nice break. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Kembali jam
12:20. Tanya guys.
Mau masuk.
Iya. Kita tanya dulu.
STIKES Hutama Abdi Husada Tulungagung is a university that located in Tulungagung. STIKES Hutama Abdi Husada Tulungagung is a conversion of school tuition learners and been built since 1986. STIKES Hutama Abdi Husada Tulungagung has facilities provided to educating student nurses. And STIKES Hutama Abdi Husada Tulungagung come from Tulungagung and several provinces in Indonesia. Respect to academic, STIKES Hutama Abdi Husada Tulungagung is accounted with national standardization. STIKES Hutama Abdi Husada Tulungagung and 5 postgraduate degrees. STIKES Hutama Abdi Husada Tulungagung library.
trying to do in one of my, especially my advanced epidemiology group, is really trying to use and get them to actually collect the information and have a number of task sheets that we use to collect information. Now, I'm sure many of you and many of the academics are probably familiar with Our World in Data. Our World in Data is a consortium between a number of universities and public health NGOs. And it has been a backbone of many of the infographics that have been available through multiple sites throughout our pandemic, and looking at the shape of the epidemic curve, and even getting our students, one of the tasks that I've used in one of my groups is actually getting students to annotate the epidemic curve in certain countries or in certain local areas, and actually identifying whether it's non-pharmaceutical interventions or the role of vaccinations. So I think there's a rich world of free data out there, and we need to be using it. And the benefit is not only can we make fantastic graphics that are freely available and available on sites, the actual numbers, the raw data is actually available to us as well. So again, this is from Our World in Data, and we can either do a comparison across various groups. This is vaccination rates, but there is so many stories to be had here. What we do know is that the vast majority of countries, are starting to get above the 50%. Sorry, the half of the world is starting to get above 50%, but there's another half of the world that is below 50% vaccination rates. And some countries, especially in the Western Pacific, in some parts of South Asia, but especially in Africa, we've got rates that are very, very low. And as you would know, in countries where you've got such logistical difficulties of getting vaccination rates out, you've got pockets so the country figures don't give us the full figure, don't give us the full information, and getting that information for local government areas, provinces, is actually equally important, and even down to suburbs. So there's lots of information that we've started to use, for example, like positivity rates and testing rates, because one of the other problems that we know is that we only know our number of cases if testing is available and if testing is regularly done. And that's been a big problem in a number of countries where testing is not easily available. And some countries have shifted to individual testings with rapid tests, a point of care testing. We're losing some of that data in comparison. And that's, I think, going to be a big issue going forward. So using all of this information, you can really see as an academic and also for students, you can follow this and you can use a lot of our basic teaching of epidemiology around the COVID that will help us with also chronic disease, but we can also do specific modules related to infectious disease and use COVID as a good case study. So one of the things I wanted to highlight was where do you get the best information? Now, apart from obviously your local CDC, we don't have a CDC in Australia, so we either need to look at our particular state government figures because we have a number of states, or we have to look at our national figures. So there's some issues that we have to face, but you can get a lot of data that goes from WHO, either through WHO, but also through Our World in Data. And some of you may have also used the John Hopkins, which uses Our World in Data information. So the other place I wanted to also highlight was some of you may have seen these infographics, which are available for free, and they're actually they put out a series. You can get the data, but you have to pay for it. But they do put out weekly infographics, and they're actually some really good insights. So that's Statistica. But WHO, the other thing that we've really faced in this period is that we've faced the issue around how do we deal with the vast majority of information coming to us, what is real, what is either, people talk about fake news, what is misinterpreted, maybe what is misinformation and what is disinformation. So one of the things that WHO did very early on is they've had regular conferences on how to deal with the amount of information that we're getting. And I think it's really worthwhile you having a look at the sites for risk communication and how to deal with the amount of information that's coming at us as clinicians that we then have to reinterpret and curate to send messages to our communities, to send messages to our public health and our clinicians, but also how do we deal with and get ordinary people understanding what is disinformation or misinformation, or here in this graphic, which is from the International Federation of Library Societies, and it has this same picture in multiple languages. So the fantastic thing that the WHO has done and a number of other international organisations have done is that they've also got most of their materials in other languages. So I think that would be quite important for you to use. We've have got a lot of a very good public health broadcaster in Australia, which also has through one of the roles of the ABC, they do have a service through the Asia Pacific, where they do have certain stories in other languages, but also SBS, one of our broadcasters does that as well. So they've been really important for showing a number of those infographics and have been very useful tools to help students in that curation of knowledge and the understanding of how to communicate risk, how to communicate the different figures, and especially as the information going out to our communities has changed during the pandemic. If you haven't had a chance to have a look at the conversation is a consortium of often academic, it has coverage across most of the world now, but one of the things that they encourage is that they have short, sharp, 500 to 1,000 word presentations, which really can look at one particular topic. And they're very good to give to students to get them. And I've used these as examples. And one of my assessments I've used is that they have to develop a short evidence synthesis of 1,000 words on a particular topic. So getting them to develop both the graphical information and also the written evidence synthesis, similarly to what they would do if they were submitting to something like the conversation. There are a lot of data visualization sites, and I've given you a couple of, this is particularly for Australian data, but Shirley Wu deals with mostly American data, but there's a lot of data visualization sites that are around. And the Gavi Vaccine Alliance has some excellent resources that you can use, especially around vaccination rates and how vaccines work. And I'll show you some examples of some of their messages now. So they have lots of organisations are using infographics, and this information is really a skill that our students need to gain. how to condense information not only into words but into tabulated forms, into infographics with visualizations that make sense that are easily transmitted then to, that can then be put in lay language, that can be translated. So I think these are examples that have come from both Shared Verified, which is a UN site, is another site, but also often from the Garvey Institute. I just wanted to put this up because I think this is a really worthwhile article for people to read, and it tries to disentangle the really complexity of the information that we've had to deal with in the pandemic. It splits it into the economic information, the interventions, how we're dealing with environmental issues, the health issue, which I think too much dominates a lot of our discussions, and then information gathering and social aspects. But really, as public health officials, we have to work across all of these sites. And I think this is probably a really good article to give your students to start them thinking about those complexities. So the other thing that we have to keep reminding our students is that pandemics like COVID, like other disasters, amplify public health challenges. And there's a number of public health challenges and ways in which you could link into this information for our students. But I think one of the major things is we know that COVID amplifies existing challenges, especially around non-communicable disease, whether it's as increasing morbidity and mortality, or whether it's in excess deaths where situations where public health and clinical health facilities are not able to deliver their usual resources, and it's taken over by the pandemic. In Australia, we have significant problems that have been highlighted through the pandemic around aged care and disability care. We all know that in every country worldwide, inequities and inequalities are rising, and there is often significant distrust in First Nations or Indigenous communities and migrant communities who often also have non-communicable, high rates of non-communicable diseases or other infectious diseases. We've got uneven health services. We've got growing health costs that are often not well targeted, and in many countries we have a housing crisis, which makes many of the non-pharmaceutical like social distancing very difficult when you've got overcrowded housing or people living in irregular housing. So the other issue that I think we have to try and deal with and try to disentangle for our students and try to get them to start curating this information is maybe putting up a press conference and getting the students to actually work out, well, what are the actual measures that were spoken about in that press conference? What is the information that is being put out, quite difficult and dense information in Australia at times, that is being put out by our governments? How do we actually try to make that more usable for both our communities? But we've got to make sure that we become the information filters so that this information is going out in a way in which it is usable for community-based organisations, faith-based organisations, and not just the media. Large media organisations, as you've probably seen worldwide, have got big infographics, and we're actually relying on them as often public health officials, have got big infographic groups or data visualisation specialists. But for most of us, we then have to filter that for our own friends and families, our faith-based communities, our social media. And similarly, we've had a situation where we've had a lot of press conferences that give a huge amount of information on a daily basis. But it's actually really hard then for people to work out, well, what is the current rules, especially when they're changing? So getting students to understand that so that they can then either critique it, but also maybe deliver it in a better format. So as I said, it really is, it is a wicked problem with great complexity. And we have to think that, do people hear all of this? Well, no, it really depends on their circumstance. And it often depends on what part of this diagram they're actually focused on. If you're losing your work, if you're unemployed, if you survive on a daily wage and you're in lockdown, then your economic concerns are your biggest concerns, and you may miss health messages. You may go also not have the ability, if you've got low trust in government, then you may again miss health messages. You may not understand the interventions, and they may be seen in an issue of targeting a particular group or a particular community. So we have to understand this complexity when we're thinking about delivering information. The other thing that I've given you a number of links to is really to try to get a common language and an agreed position about these myths. So WHO has spent a lot of time looking at the various myths that are arising in communities and trying to come up with both infographics in various languages, videos, and I would really recommend that you actually visit the WHO sites. We have to try and start to deal with this. We have to get this information delivered by a variety of sources and by people who communities trust. And that is becoming really important. So I know that was a very quick view through all of the things that have happened over the last 2 years. But I think unless we reflect on where we are, what we've used, what's been good, and we start sharing that information between us, both inside our own institutions, but also across the world and across especially our regional groupings like this, then I really think that we're not going to learn the lessons that we need to learn and build public health as it needs to be built. So thank you very much for listening.
On how we teach our students, especially in public health. Okay, and then we will hear the presentation from Jericho Parosi PhD before we move on to the Q&A session. Okay, Jericho Parosi, how are you?
I'm very good, Riza. Nice to see you virtually.
Okay, nice to see you virtually. I think after 2 years, I haven't seen you maybe on 2 years. Okay, it's very nice to see you again here in this conference. Okay.
Thank you.
I think I need to write the CV from our speaker, Jericho Parosi PhD. So for now, he is a lecturer and researcher in the Queensland University of Technology. His bachelor degree is from University of Indonesia, and then the master degree is from University of Queensland in International Public Health. And then his PhD is in Macquarie University, Australia as well. He has a lot of publication. I think mostly in his expertise on maternal health. Before I let the Jericho Parosi to present his presentation, I will invite to ask to our two speakers, Dr. Kylie Dingle and then Jericho Parosi. Please write on the chat box. And then for now, Jericho Parosi is now is your turn. Thank you.
Thank you, Bariza. Thank you for the organizer. Let me share my screen. Is it clear with my audio? Can you all hear? Okay. So first of all, I would like to acknowledge the Turrbal and Niagara as the First Nation owners of the land where I now stand. Also QT stands. I pay respect to the elders, laws, custom, and creation spirit, and recognize that this land has always been places of teaching, research, and learning. So these are the outline for today. I'll try my best to speak in the next 25 minutes by focusing on past, present, and future, specifically for maternal health. So let's start about understanding human life stages. It's very important. We all go through different stage, whether you are now as a middle age, as an elderly, or at the moment you are a young adult. But importantly, the well-known definitions of maternal health that has been used always refer to the health of women during pregnancy, childbirth, and the postpartum period, which there's an issue there. When we look at the context of low and middle income countries, I think we do need to redefine what we mean by maternal health, because it doesn't fully consider the health of women who are not mothers. So it's mentioned that earlier, it's about pregnancy, childbirth, but how about women who are not mothers? And also include many other problems that lead of women have in all societies. So I just put it there. The maternal health doesn't stand alone. It's really important if you're working with women, with pregnant women, with children under 5, the support provided by the surroundings, the support provided by the micro and the meso level. Which again, you can see here, this is the kind of influence. So when we are talking about maternal health, we do need to put more focus, understanding about the influence of the societies, starting from your family, your mother-in-law, the influence from your mother, the influence of husbands, not allowing not allowing pregnant women to deliver at a health facility such as Puskesmas or Pustu. But we also need to consider the impact provided by the community level, the religious leaders, the local tradition community leaders, including the national and global. And if you are not aware, why do you want to focus on maternal health? Why is it so important? Well, let me tell you why, because even with the current sustainable development goals, we are still witnessing many women, pregnant women, regardless whether they are mothers or not, including neonatal children, newborn and under 5, still suffer and still die because the neglections from the societies. And when you look at back the Millennium Development Goals, starting in 1990s, end up in 2015, they actually put maternal health as one of the global priority. Now, I just put there, one of the goals is to reduce maternal mortality ratio to reach at least fewer than 70 maternal deaths per 100,000 live births by 2030. So the next question will be, what will happen because of this global pandemic of COVID-19? Will many countries meet that target, the specific goals to reduce maternal death or maternal mortality fewer than 70 per 100,000 live births? Well, let's have a look at the data. Starting from the 1990s, taken from the Bill and Melinda Gates, the Goalkeepers report. Now, as you can see here, this is the situations for Indonesia in the end of 2019, so 136. The target for 2030 is 70, so it's double. We do need to accelerate more faster pace in order to meet that sustainable development goals, particularly for the maternal mortality ratio. But again, the problem right now, we do need to consider, do we have enough resources? Do we have what it takes to meet that goals by 2030. So the question right now, how far the progress of maternal health in Indonesia prior to the pandemic situations and during the pandemic or even post-pandemic situations? How about the status of maternal health care services, including the health insurance? And in the last two slides, I'll explain briefly what more needs to be done to ensure better maternal health outcomes. Because healthy mothers, you have healthy babies. Healthy babies, you have healthy generations. And healthy generations will influence your healthy community that will lead to healthy nation. Now, just want to give you more kind of ideas to understand what is going on in terms of Indonesia maternal mortality rate. As you can see here, this is coming from different data sources, from the Demographic Health Survey, from the UN model, even from the Millennium Development Goals and Sustainable Development Assumptions. As you can see, it's true that we are witnessing decline of maternal deaths in Indonesia over the last few decades, but are we there yet to meet by the 2030? At this stage, I would say I'm not sure about that one. I'm not fully confident about that one, whether Indonesia will meet that target of 70 maternal deaths per 100,000 live births. And when you compare to neighboring countries on your right side, as you have a look on this one, the changing from 2000 to 2017, as you can see, Indonesia is putting in top 4 as the top 4 in terms of maternal mortality ratio. And when you compare to Philippines, when you compare to Malaysia, or even Vietnam or Thailand. When you look at this map, it gives you more ideas. The obvious assumptions will be high inequities, high discrepancy among regions, within provinces, and within districts across Indonesia. So the dark blue represent more maternal deaths. So in East Nusa Tenggara or Nusa Tenggara Timur province, part of the Sulawesi, in Papua. And when you look at this one, we consider this one eastern part of Indonesia. So there is a massive inequities and inequalities when it comes to maternal mortality ratio and ways to improve women's health across provinces and districts in Indonesia. In terms of the skilled birth attendant, because I noticed many of you midwife, future nurses, and also future health graduates. Yes, when you look at the 1987 data, it shows an increase in terms of the utilizations of skilled birth attendant, whether you are a midwife, a doctors, or nurses. But when you look at on the right side, when you look at the traditional birth attendant, especially for the rural sites, it still has quite a high proportions. Using the 2012 Demographic Health Survey, we still have 20.2% women preferred home delivery with also by helping or provided the assistance from the traditional birth attendant. And I guess from my own experience during my master's degree and doing research on maternal health in eastern part of Indonesia, I would say the reason why many women still prefer traditional birth attendant because of the extensive services provided to these women. So they're not just helping you with the delivery, but they also help you with your home duties. They're also looking after your children, or even in some instances, they actually help with your farming activities or with your sea activities. So we're still dealing with complex issues in terms of how do we progress? How do we decline maternal deaths over time to meet that SDGs goals by the 2030? This is a study conducted by UGM, Universitas Gadjah Mada, and NTT, District Health Office, Provincial Health Office. If you're living in Java, that's lucky. You're lucky because most of women and mothers will give birth in the hospital or at least in puskesmas or the clinic bidan. But when you live farther from the Western Indonesia, so if you live outside Java, if you're living outside Sumatra, most likely you will experience home delivery, which is considered as a non-health facility. And we understand the complications, the potential obstetric complications when you give birth in home delivery. When it comes to maternal health insurance, I'm not going to explain this one further details, but the overall kind of assumptions or implication, there are still many poor and near poor populations across eastern part of Indonesia in particular, having difficulty to access even the closest health facility because they don't have enough funding, they don't have the card, they are not enrolled yet with the National Insurance Scheme, also known as BPJS. Now, I've been talking about a lot of issues. So what can be done? Well, using the 6 building framework suggested by the WHO, we need to ensure adequate health facility by having this or meet these 6 components. Adequate health staff. We have enough equipment. Adequate health supplies or medicines for mothers or even during the obstetric complications. How about the blood bank availability? Is it safe building for mothers to deliver? How about the referral systems and also the support from the budget? Now, many of you will be familiar with the 3 delays model. And the reason for me to put this one, because it is interesting when you look at the current pandemic situations, nothing much changed in terms of these delays, especially for mothers in the context of Indonesia, whether you are a pregnant woman, about to being pregnant woman, or post-pregnant. So the first delay is about making decisions. Unfortunately, pregnancy for many societies, even in Indonesia, I have to admit, I used to be that kind of person with that perspective that pregnancy is just women's business. Well, let me tell you, pregnancy is not just women's business, it's everyone's business. Remember, healthy mothers, healthy babies, healthy community, and it will lead to healthy nations. With the second delay, it's more about delay in reaching health facility. That's pretty obvious, isn't it? It's like a sequence kind of response. If you are having difficulty as a woman to attend puskesmas, to go to pustu, because your family rejected the idea for giving birth at the health facility, then most likely when it comes to making that decision, you will have a delay in reaching the health facility. Especially if you're living in rural island or remote island. I've been in many parts of remote island across eastern part of Indonesia where you have to travel so many hours just to reach the closest health facility. I think the furthest one that I've experienced is like 12 hours by boat in one part of the remote island in Maluku. Just to reach Pustu. It's not about puskesmas. This is even puskesmas pembantu. It's not just, it's not yet to reach the puskesmas. And once you have that delay in reaching health facility, you have the third delay, receiving the care. Do you have enough doctors, midwife, nurses? I have to say this one, but do you have really a passion to help mothers? If so, then whenever you are placed, whenever you are a base, whether you are in rural and remote island, please make sure that you stay there longer, not just move to urban cities. Because as you move to urban cities, you are actually creating a new, and you are actually creating a classical issues of delay in receiving the care because we don't have enough staff. So in recent years, experts start talking about, hang on, I don't think it's the first delay, the second delay, or the third delay. If you're living in a strong traditional cultures, if you're living with a strong patriarchal, where husband hold all decision making, then you need to target the fourth delay, and that is the community support for preventing maternal death. A lot of empirical studies have shown the variations of delay. So if I go back, it doesn't necessarily that for many of you, you have to go through the first delay, the second and the third delay. Sometimes you can experience only the second delay or even the third delay. Most likely, you will go with the fourth delay if you are living in a strong traditional communities. I'm going to skip this one because I'm sure many of you at least been to Kupang or any other district, but this is coming from studies that we've conducted with my former supervisor back at Macquarie, funded by WHO and USAID, looking at and evaluating the 2H2 systems. So the 2H2 system, 2H2 stands for 2 hari sebelum dan 2 hari sesudah, which means 2 days before the delivery, you have to make sure that that will stay close to the puskesmas, also known as rumah. And 2 days after, you have to make sure that that women with their babies stay close in the puskesmas for further postnatal services and checkup. So this is just to show you, again, a classical issues when it comes to eastern part of Indonesia. Still preferable home birth facility and also assisted by the TBA, also known Duku. So what did we find? Because it's interesting, as I contemplate this one with the current situations during the COVID, it still remained the same. Women having the lack of decision-making autonomy for women to utilize their own maternal health care services, which could lead to lack of awareness of pregnancy danger signs. And again, for many educators, for many lecturers, you have to make sure that you provided adequate informations and in-depth details about ways to prevent this first delay, about ways to improve women's knowledge about pregnancy danger signs. How about the second delay? This picture is actually showing you a short video, which I'm not going to show this one because of the time constraint, but it shows you from the ambulance, they're gonna bring the pregnant women to this green boat. And then they have to reach at the back of that mountain, which took around 2 hours. And unfortunately for this pregnant woman who's about to give deliver is having a bleeding issues. And we all know what happened if a pregnant woman having a bleeding issues. You need to make sure a shorter time just to prevent maternal deaths. So the second delay is about the modes of transportations. How about the distance? The third delay is more about the health staff availability. I waited too long in the hospitals. I was screamed by the midwife and the nurses saying, just be patient, we're trying to help you. Just to remind everyone as a future nurses, as a future midwife and a future health graduate, please make sure that you provide high quality of services to the populations, because at the end of the day, we are actually trying to contribute to our populations. I'm going to skip this one. This is just to show you another discrepancy within district. It is only from one province. And I'm sure similar scenarios, when you look into Papua or Maluku or even Sulawesi, you will see the same kind of patterns. So how we deal with the fourth delay? This picture is showing you Umakububu. It's like, they usually put women to stay there for around 6 weeks, up even to 3 months after delivery. So you'll know what sort of difficulties, what sort of health issues. And unfortunately, in this house, it's not just a house. No ventilations, it's only one door. And it's a smoking 24/7 because they believe it's not commonly exercised anymore in NTT. In some part, there's still kind of pockets of tribes, they still exercise this one. Again, we need to educate how to improve women participations. So these are the barriers and enablers. I'll give you time to read it later on, but this is the suggestions. Ibu stand for mothers. So Ibu in Indonesia stands for mothers. So I do want to suggest to you, improve the quality of maternal health care services. And how do we improve the quality? By improving the core capacities, the core skills from our health graduates. Building trust. You need to build your trust with the community. You need to talk to your community leaders. If you are situated in rural and remote island, go visit the marketplace. Talk to the elderly people there to know what sort of expectations that they really hope when you are situated in that region, in the village or districts. And it's important to understand women's rights and needs. And to end up the sessions, I want to suggest rethinking maternal or even health educations by using COVID acronyms. Because of COVID, we changed the course delivery to online through remote distance. We changed the learning platform, not just about chalk and board, not just board marker and whiteboard, but now we change into a digital kind of approach. And with this COVID, it actually provides with the opportunity for greater collaborations. As you can see right now, I don't have to travel from Brisbane to Jombang. I would love to travel back to Indonesia, and hopefully post-COVID, we can see face-to-face, and I will have the opportunity to visit all these 8 wonderful colleges. And also with COVID, it actually shaped the vision for well-trained graduates. What sort of health graduates are we expected to work during this pandemic or post-pandemic? Because I'm sure, I'm not praying for another outbreak, but there's the possibility, for future health threats. And also, we need to rethink the way we educate our health students by involving intersectoral approach, by allowing government, community agencies, local NGOs to teach, come on campus or virtually and educate students on what to expect when you are working in the community. And I would say, strongly suggest that this is the kind of the visions for in the next future, I will say in the next 10 years, that all health graduates should need to have digital delivery, ways to deliver digital informations, literacy, and the way you communicate the informations. And how do we change? How do we change the health educations in Indonesia? I use the acronym again in Indonesia. Interactive and personalized learning flexibility. Moving from factory kind of approach, now more personalized. We need to acknowledge the issues faced by our students. Not all of them have adequate internet connections. Not all of them have a well-supported laptop. How do we deal with those situations? Network with both domestic and overseas institutions. This is the right time for you to reach out to different organizations. And obviously, as mentioned, and I would like to echo what mentioned earlier by my colleague, Dr. Kaylin, digital applications in terms of how you analyze big data and how will you disseminate those data. Through ongoing collaborations, do you have your numeracy and data management skills? How will you enhance the health literacy with multi-sectoral actions? If you're not a big fan of politics, unfortunately, if you are working in health, you do need to understand about the political kind of structure, the influence of political structure within health and within health institutions. So that's why you do need to kind of combine industry engagement. I'll end up with this one. Women are not dying of disease we can't treat. They are dying because societies have yet to make decisions that their life are worth saving. Thank you so much.
Okay, thank you very much for Jericho Pardosi for the very great presentation. Okay, so for now, we will move to question and answer session. The first question is to Dr. Kaylin. Dr. Kaylin, are you here with us?
Can you hear me?
Okay, okay.
Yes.
Thank you very much. Even though I know you already answered that question on the chat box, I will again read that question. Okay, the first S, in this pandemic situation, we have no choice. We have to do the education in online. However, online system is quite hard, very exhausting as well, and it is less effective and rather than the usual method. Do you have any comment on this?
Look, I think it is hard. There's no doubt about it. But I think what we shouldn't be doing is, what we should try and do is, instead of constantly reinventing wheels, there's actually some really good support systems out there. And I'd echo what Jericho said, is that one of the things that we've got to do is we've got to recognise that we've just got to do this. So we've got to work out how we can do it in an efficient way, so we don't we leave that academics actually have the ability to do this. Now, I think for their own lives that they've got, you know, those issues. But we've also got to be, as Jericho mentioned quite well, is we've got to be realistic about our students as well and their abilities. So if I think what we have to do is we have to ask them. One of the things that we had a situation where we had some students who were in Nigeria who had very difficult internet access and quite different timelines, time zones. I think what you have to do is, rather than talking to each one individually, because we don't have that time, what we have to do is bring them together. So try and find the people who've got the common issues and actually bring them together. So the thing I would say is, in my experience, I can put up videos on my Blackboard site or the equivalent of learning management site. I can give the links to the students, but they don't go and look at it. The small group of high achieving students are the ones who will, if they have time. So you've got to realise that it doesn't matter how much information you give to them. What you've got to do is use that information. So what I'd suggest is, and what we tried to do in our advanced EPI class, was I would give them tasks where each person, you know, a group of people, and I try to actually do it as a group. Now, we didn't have big numbers, but maybe that's the thing that you can do, is if you know that there's a group of people who only have one computer, or get them to actually come to a site and say, okay, I'm going to give you these tasks. Try and give them the task beforehand, but actually give them the information, and I would also give them the solution, but not at the same time. Give them the solution later. And get them to do the presentations, get them to engage with each other, because students get a lot of information from other students. And unless we realise that, sometimes that information isn't great, sometimes it's fantastic. And they're much better at talking at the level at which our students need. But maybe we need to be involved in that, you know, having breakout rooms where we can drop in. So I think we just have to accept that it is the reality of our lives going forward, and how best can we do it.
I think I have read the question, like compared to neighborhood country like Malaysia, Indonesia have quite high maternal mortality. What is actually happened in Indonesian context, and then how should we respond this? What we can do? Thank you very much.
That's a simple questions, but you know, it's really hard to to answer in a way where we can understand. Again, when we look at about maternal health, we do need to acknowledge their important roles in our societies. At the end of the day, what I suggested earlier, quoting from Professor Mahmoud Fatala, many women in developing countries, they're dying because the society hasn't made any decisions that their life is worth saving. So why maternal death is still high? Because it's not a priority for many reasons. A part of the political, kind of campaigns. When we look at the political campaigns by our politicians, they always talk about, yes, we're going to ensure that we're going to prevent maternal deaths, good promises, but as they manage to see it in the parliamentary, it's all gone. So that's why I was saying earlier, as a future health graduates, you do need to understand about the political constraint, about the influence of political power and structure within the health policies. I'm not being pessimistic because many regions in Indonesia manage to improve their maternal health situations by engaging the community, by acknowledging local customs. Now, don't get the idea wrong saying, oh, local customs is entirely wrong. No, it's not actually wrong. When you look back, 100 years ago, ancestry, they were talking about different ways to save mothers from their delivery. Yet they still live longer than many of, our populations these days. So I guess why maternal death still high? It's not a priority right now. Our priorities keep changing, and it's a kind of fragmented actions. When you go to the puskesmas as a midwife, you are expected to help immunizations. You are expected to help environmental. You are expected to help the dengue program. You are expected to do health promotions. So multiple roles, even as a health staff. At the end of the day, do you have enough time to focus on maternal health? I doubt it.
Okay. Okay, so the political will is the key to improve the maternal health, to reduce the maternal mortality. Okay, so second question for Ms. Kylin Dingle. So do you have any comment on how to manage information about COVID-19 in community? Because in her opinion, from Futika Permatasari, she said that actually when we manage information to our student, it's actually quite easier compared to manage the COVID-19 information to community.
I think it goes back to something that Jericho said, is I think what we have to do is, first of all, who is this community? How can we actually reach them? So I think what we have to do is bundle that information. So clearly there is some information, especially during the pandemic, that has to come through the political leadership, the regional, chief medical officer, whatever it is. But I think a lot of it can also be using those community links that we have and actually trying to reach out. And look, I know this is tiring, but using key people, if we've got key people in, say, the maternal and health program, in the TB program, in the malaria program, why not have a talk to them and ask them, are there questions coming up? Can we link in and maybe have 5 minutes or 10 minutes of your time at the end to look at, are there issues around people being terrified about getting a COVID vaccine? What are the issues? So I think too often what we do, and we do it hugely, and we haven't done well in Australia with our linkage into communities. What we've done is we've done general broadcasts across the mainstream media. And I think what we have to do is break down who's the community and try to work out where are the people who we can link to, who are the trusted sources. And don't forget, oftentimes the biggest place may be faith-based communities, maybe through the mosque. And that's what we saw in, say, in Western Sydney. Once it was given to the hands of the community, they set up vaccination clinics and they set up at mosques, they set it up at churches. And that was actually more useful than anything really that the health department had done. That, and it's similar with Indigenous communities, Aboriginal communities in Australia. We have to acknowledge that, there's all sorts of issues that we just can't bundle in and go, oh, here we are, we've got all the knowledge. We don't. We've got to work out who the community are and take different messages to different groups.
Okay, thank you very much, Caroline Dingle, for the answer. Okay, so I will again read the question to Jericho Pardesi. Okay, so do you have any opinion on strategy management on maternal health in COVID-19 pandemic, specific in this era? Thank you very much.
Sorry, Barisa, can you repeat again? There was an audio while you were saying questions. Can you repeat the question again?
Okay. During this pandemic, especially during this pandemic, do you have any special management strategy for maternal health, or actually that a strategy that we use before pandemic is actually we can use it during this pandemic as well? Thank you very much.
Thanks for the questions. I think Kelly already mentioned that most of the time when we develop health interventions, it is not necessary for us to reinvent the wheels. So when it comes to the management strategy for maternal health, ensuring high quality of maternal health during the pandemic, what we need is to be aware and to be familiar with the health preparedness or health emergency preparedness, which means we do need to add or set up more protocol, obviously following the protocol suggested by the Ministry of Health or provided by the Satgas COVID. And obviously we do need to train our healthcare workers to be aware about the hoax informations, as saying by Kaylin earlier, misinformation, disinformations, that will ensure at least that we can continue to provide high quality of services. So the key is to be familiar and to be aware with the health emergency preparedness. And, it's like a dream for many people, like it's 2 years right now and we're still living with COVID. No idea when this COVID ends. At the end of the day, we just have to deal and live with it. To live with that one, obviously, we do need to educate. We do need to adjust numbers of referral systems, the flow of our services to make sure that we prevent transmissions among health staff or among mothers who are going to attend our clinic.
Okay, thank you very much. Okay, because we're running out of time, I think one more question for Dr. Kaylin and then one more question to Dr. Jericho. Okay, to Dr. Kaylin, as a moderator, I have one question. Even for me that have work in public health area, it's very hard for me to catch up the new information that keep coming about public health, and the information itself is so complex. So
yes,
in my experience, it's very hard for me to just catch up about the new update and the new science in COVID-19. Do you have any comment on this?
I think, look, I don't think you can. I think what you have to do is find some trusted media sources. So, for example, I try and listen. There's a regular podcast through the ABC called CoronaCast. I listen to that. It's a 10-minute podcast. And then I use the conversation a lot as well, because there's a lot of writing around that. And then I usually try and read a couple of key blogs that are going to distill the key messages. And then if I want to look at the reports and read the reports, I'll go and read the reports if it's relevant. But very few of us have the ability to do that. Similarly, I think one of the things that we have to do is, instead of seeing this all as only my job, instead, you should be trying to use what's available. So, one of the things that I did for our advanced epi students, was during the COVID pandemic, Coursera has a number of free courses on contact tracing. And so does WHO. So I said to them, if you want to get 10 marks, go and do those courses and show me the proof that you've done them. I didn't set up a module on contact tracing. And I knew that the people in public health departments weren't going to do it for me because they're incredibly busy. So I think what we've got to do is try and use resources that actually exist and stop being scared of that. We want our students to curate and understand the resources available, not expect that we're going to be the purveyors of all wisdom.
Okay, thank you very much for the answer. Okay, the last question to Dr. Jericho Pardosi. The question is how to gain public trust on in the chat, we can see that some of the community didn't trust the health worker when they have to give the childbirth. So how should we respond this? How to gain the public trust on healthcare worker?
Well, again, I just want to echo what Kaylin already explained earlier. Building trust, it's not easy. Building trust take perhaps longer time, but it will start by having that kind of sincerity that you are trying to help the community, that you are trying to improve maternal health. So simple actions like, even as a new midwife, new graduates, talk to the religious leaders, talk to the key informed kind of stakeholders within the community. Things like the Pak Ustadz or Ibu Haji, talk to a well-known person as respected, elderly or respected person, and understand what do they believe, what do they understand about maternal health, and you can start from that one, and you'll be surprised of how many kind of unexpected informations, because I've been in that situations when I went to NDA to collect my data. Start talking with the local community leaders. I've never imagined that the more rich data that I could obtain just by having a sit down, drinking coffee in warung kopi, and then it actually exploded to 3 hours of conversations. And another side, as a healthcare, you do need to present yourself professionally in terms of the way you speak, the way you communicate, the way you respect. People will see or people will judge your performance not only when you are working in the health clinic, but what happened after you finish your work. Many people, especially if you are working in the rural areas, in villages where you have, less populated, people will aware about your behaviors, your actions. There's no kind of simple action to that one, Bariza, but again, it all coming back to your sincerity in helping the societies, and also learn their languages, learn their customs. That's the only way to be accepted by the community.
Okay, thank you very much for the presentation and answer to Dr. Kaylin and Jericho Pardosi, PhD. And then for now, we want to appreciate your sharing experience by presenting the certificate. The certificate will be presented by the Dean of STIKES Bakti Mulia, Mir Selvi, MCAP. And then for the IT team, please help us to show the certificate of appreciation from the GIC. Okay, so
on behalf of the GIC committee, I would like to thank you for the topic you have shared with all participants. We present the certificate to you as a speaker in this event, Dr. Kaylin.
Thank you very much.
Yes, and also for Dr. Cheriko Pardosi, thank you for the topic you share with all participants. We present the certificate to you as a speaker in this event.
Terima kasih, Ibu.
Sama-sama, Bapak.
Okay, thank you very much to Ms. Selvia MKep as the Dean of STIKES Bakti Mulia for the presenting of our certificate of appreciation. Okay, that's all for me. That's all from me, Riza Yuliawati, as the moderator in this session. Thank you very much for the speaker and then for the participant as well for joining this conference. And then I will give back to MC for closing. Thank you very much.
All right. Thank you so much, Ms. Yulawati SKM MIPH. So, dear participants, ladies and gentlemen, we would like to say thank you for being the great moderator to have the fruitful discussion in the session. And before we end the first day of the third Joint International Conference 2021, there are some information that we should share. The first is, participant, please, you can fill in the invitation form, the Google form prepared by the committee, as the link shared before for the speaker 1 and speaker 2. For speaker 1, Dr. Kailin Dingle, PhD, MPH, and as well as speaker 2, Dr. Cheriko Pardosi, PhD. You may fill in the Google form. Then number 2 is the for tomorrow that we'll start the program at 7:30 in registration session with the new Zoom link. The link will be shared soon. And so when you have entered the Zoom, please rename your account as you have used the codes given by the committee. And then for the speakers in oral presentations, for those who have not submitted the video presentation to the committee, please be ready to have the presentations lively tomorrow at the oral presentation sessions. So don't forget that we still have day 2 of the third Joint International Conference tomorrow with the great speakers. The speakers are from America, where Dr. Barbara Richardson, DNPRN RNPP, and also Dr. Michelle White, DNPRN RPRN VNBCBC from Lee University, America. Thank you so much for the nice day, this event for the first day of Joint International Conference. Thank you for joining the actively participating during this day. Have a nice day and see you tomorrow morning with a better condition. Thank you so much for all. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.